I read somewhere that King Sunny Ade had stated that he heard a piece of music and knew immediately that it was my sound. And that comment blew me away because to me the greatest flattery that anyone could say was that I have a unique sound, and that's what I'm working for. That's my goal, is to come up with something that's different and my own.
Yatharth is not just
हैंड दो, हैंड माइक, पोडियम माइक, चेक। हेलो हेलो। आप हेड पे लगा, हैंड को ऐसे लगा, ये डाल लेना। चेक 1। म्यूट अनम्यूट ऊपर ही है।
Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives.
The sky is full of stars, and among us we have the shining ones to sparkle their light on us through their rich experience and knowledge. Good morning, ladies and gentlemen, esteemed guests, scholarly delegate, a heartfelt welcome to you all. We have assembled at this prestigious venue for the conference Yatharth Horizon, Role of Nursing in Modern Day Healthcare. I, Neelam Singh, will be the beacon to guide you through today's invaluable intellectual exploration. As we journey through insightful presentation and stimulating discussion, let us remember that our purpose is to learn, collaborate, and catalyze change in role of nursing in modern day healthcare. Today, on this momentous occasion, we would like to welcome the various dignitaries who have joined us today with a small pot of plant as a token of a delight and respect we owe you for being significant part of this abiding occasion. To begin with, I would like to call Mr. Anil Vitti, sir, to welcome Colonel Binu Sharma. Ma'am, please welcome on stage. Now introducing and inviting Ms. Josephine Cyril. Now I requesting Ms. Shinu Vargas to welcome Ms. Josephine. Now I invite Mr. Abednego Peter Johnson, Nursing Superintendent, Sitaram Bhartiya Institute of Science and Research, New Delhi, requesting Dr. Reema Sri to welcome Ms. Johnson. Mr. Johnson. Thank you, everyone. On behalf of Yatharth Hospital and Trauma Care Service Limited, I extend a warm welcome to all senior nursing professionals and participants from various hospitals. Thank you so much for gracing the event. We acknowledge our reverence for wisdom and knowledge by lighting the lamp of enlightenment. Ladies and gentlemen, to do the honor, we have an esteemed gathering among us. May I please request the dignitaries and speakers to kindly join us for the lamp lighting ceremony. Colonel Binu Sharma, Mr. Abednego Peter Johnson, and Ms. Josephine Cyril I'm requesting Ms. Sheenu Varghese ma'am, Anil sir, Deepika ma'am, Achal ma'am, Rima ma'am, Mansi ma'am, please join us the lamp lighting ceremony. Dr. Upendra sir, please join us.
Shubham kurutvam kalyanam.
Vidhi ma'am, please join us for the lamp lighting ceremony.
Shubham kurutvam kalyanam. Arogyam dhanasampada. Shatru buddhi.
Vaishali ma'am, Dr. Vaishali ma'am, please join us.
Deepajyotir namostute. Deepajyotir namostute. Deepajyotir parabrahma. Deepajyotir janardanah. Deepajyotir parabrahma. Deepajyotir janardanah. Deepo hartu me papam. Sandhya deepa namostute. O deepa brahma rupasvam. Jyotisham prabhuravyayah. O deepa brahma rupasvam. Jyotisham prabhuravyayah. Arogyam dehi putrausha. Matim swachham hi me sada. Raverastam samarabhya. Yavat suryodayo bhavet. Raverastam samarabhya. Yavat suryodayo bhavet. Yasya tishte gruhe deepa. Tasya nasti daridrata. Shubham kurutvam kalyanam. Arogyam dhanasampadah. Shubham kurutvam kalyanam. Arogyam dhanasampadah.
Ma'am, please wait.
Vinashaya.
The lamp is now lit, and may I request the guests to kindly give us the photo opportunity as the photographer is waiting in anticipation.
Kalyanam. Arogyam dhanasampadah. Shubham kurutvam kalyanam. Arogyam dhanasampadah.
Thank you everyone
Yatharth
for doing the
is
honor.
not just one word. It is our assurance to patients. It is the passion of our doctors. Spot in tiny detail. Team strives.
Auspicious event starts with the prayer. We will spend this moment with Lord Ganesha to gain strength and blessings to make this event a success. We have Miss Meenakshi Sharma amongst us to lead the prayer on the stage with Ganesh Vandana. So ladies and gentlemen, put your hands together for Meenakshi Sharma.
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
लाल चढ़ायो अच्छा गजमुख को जोन दिल लाल विराजे सुत गौरी हर को हाथ लिए गुड़ लड्डू साई सुरवर को महिमा कहे न जाए लागत हूँ पद को जय देव जय देव जय जय जी गणराज विद्या सुखदाता धन्य तुम्हारो दर्शन मेरा मन रमता जय देव जय देव खालील लोटांगण वंदिन चरण डोळ्यान पाहिन रूप तुझे प्रेमे अलंगिन आनंद पूजन भावे वाळिन म्हणे नामा त्वमेव माता पिता त्वमेव बंधुश्च सखा त्वमेव विद्या तरुणं त्वमेव सर्वं मम देव देव कायेन वाचा मनसेन्द्रियैर्वा बुद्ध्यात्मना वा प्रकृति स्वभावात् करोमि यद्यत् सकलं परस्मै नारायणायति समर्पयामि अच्युतं केशवं रामनारायणं कृष्णदामोदरं वासुदेवं हरि गिरिधरं माधवं गोपिकावल्लभं जानकीनायकं रामचन्द्रं भजे
Thank you, Ms. Meenakshi, for creating such a spiritual environment. Without further ado, let's dive into a promising schedule. I take a great pleasure in inviting Ms. Sheenu Varghese, Chief Nursing Officer, Yatharth Hospital, Noida Extension, to the stage to show us on Yatharth Way Forward, Nursing Excellence and Growth. She has done her PGDHA and Quality Management in Healthcare. She stands among us with 26 and above years of experience. She has been associated with Quality Council of India. She is an NABH assessor since 2013 and also internal assessor for ISO 9001-2000. She bagged so many awards like Best Communicating Nurse, Outstanding Contribution in Enhancing Nursing Quality, Significant Contribution towards Clinical Excellence and Patient Safety. She is one of the jury members for pre-screening of Aster Guardian Global Award 2023. She has been a part of CNN News and Times of India during COVID frontline fight. Ma'am, welcome on dais, ma'am.
Thank you, Neelam. And I'm so happy that across Delhi NCR, so many people have come on our invite and attending this knowledges and learning experience from Yatharth Hospital. That gives me a proud moment. Thank you so much, everybody. I'll not take too much of time and just go through the presentation fast because I know it's a lengthy day and sitting the whole day over here will be a tedious job for you all. So first I take the privilege of welcoming Colonel Binu ma'am, Josephine ma'am, and Abednego Peter Johnson. Captain Sandhya Shankar and Dr. Mani will join us shortly. Thank you, ma'am and Abed, for taking the time out of your busy schedule and coming and enriching us with your experience and knowledge. Thank you, ma'am. So Yatharth Hospital is 4 super speciality hospitals in Delhi NCR, and we have 1 in Jhansi. We are 1,400 beds with more than 600 doctors and more than 30 specialities in our hospitals. The Yatharth Group journey started in 2010 in Greater Noida, and then the journey went to 2013 in Noida, and our hospital, where we all sitting here, started in 2019, and Jhansi, we recently procured, that was in 2022. We were accredited with NABH since 2021 August, and in February 2022, we got our NABL accreditation. This is our leadership team: Dr. Ajay Tyagi, Chairman of the hospital; Dr. Kapil Tyagi, he is the Managing Director; Mr. Yatharth Tyagi, he is the Director; and Mr. Amit Singh, he is the Group CEO. So I would like to start with the Florence Nightingale's quote, which is, "People with goals succeed because they know where they are going." So committed to excellence is Yatharth Hospital's nursing. It is visible to all that healthcare is rapidly changing and is always the result of high intention, sincere effort, skillful execution, and the vision to see the challenges as opportunities. The nursing leadership at Yatharth Hospital supports a caring environment to promote growth, education, and self-actualization. Our nurses are committed to provide the highest quality care possible to their patients by valuing continual learning and clinical expertise. We emphasize on improving nursing practice by focusing on enhanced critical thinking and problem solving, communication, delegation, mentoring, and other essential skills. The nursing professionals are the frontline staffs with whom the patients and the families interact first. Their knowledge, skills, attitude, communication, and other soft skills make all the difference in the ultimate delivery of healthcare to the patients. So I believe nursing is a service, not simply a job. Every hospital has a vision and a mission, but here nursing also has a vision and mission: to be nationally trusted for patient care with excellence, and mission is we care our patients with healing touch. Our core values are safety, respect, empathy, continuous learning, evidence-based nursing practice. The aim of nursing in Yatharth is to establish Yatharth Hospital's nursing as a chain of trustworthy healthcare organization with the best environment for professional growth. Our current strength is 254, and the workforce for which I am proud is that 70% of our nurses are more than 3 years of experience, which gives good results for patient care. The customer feedback I want to share, that nothing has gone below 95%, it is always above 95%. The proud moment we felt was when we completed our Nursing Excellence Certification Assessment in the month of July, and the certificate is awaited by the end of this month. Now going forward, our academics, we have our induction program named as Train to Excel induction program. We have our on-the-job training, which we are more focusing on the-job training because I feel classroom trainings are sleeping hours. So the more we focus on the OJT, the more we get more learning from for the staffs. Then in-service education, new equipment trainings, error-based trainings, all the critical care areas with ACLS, PALS, NALS, and BLS for all nursing staff. We took up a project on sample rejection because we found that in the month of June, we had more than 56 samples which were rejected from the lab. So we were quite worried, and we took up this as a project. And now we are sustaining with less than 9, 5, like this. So it was a project taken for quality improvement. Going forward for quality, that's audits related to nursing care, quality improvement programs, TAT for nursing procedures, and we have also link nurses, which going forward we'll be taking more link nurses because infection control is the best thing which we can improve patient satisfaction and care for the patient. I'll just go through a few glimpses of our academics. Our celebrations, which keeps the team bonding. We recognize the staff when they get good appreciation from patients. We do give them appreciation notes and thank you cards. These are the bonding with the patients which we have among with the nurses and the doctors. Now the milestones which we have achieved is first successful bone marrow transplant, kidney transplant. We have our IVF, the CABG done recently. Now way forward, we have to focus on the evidence-based nursing practices, preceptorship. We want to create specialty modules like critical care, OT, dialysis, infusion nurses, medication nurse, stoma care nursing, pain management. Since we are a new hospital and small steps is the success which I feel, small and steady steps we will take, and we will certainly reach to the extent where nursing will make a recognition and name. Going forward for nursing quality, we are looking forward for JCI accreditation. We are on the process. We have already applied for it. We are going to create quality champions in every department and more projects to improve nursing care and increase patient satisfaction. Thank you. It's just the beginning of Yatharth nursing. Thank you.
Thank you, ma'am, for setting the stage and eloquently outlining the way forward nursing and the purpose of our gathering here. It will be great privilege for me to invite Colonel Binu Sharma, Senior Director, Nursing Pan Max, on the stage as the speaker of the session. The topic is Empowering Nursing Through Competency Building. Ma'am has over 4 decades of experience in nursing service in the armed force and private sector, in clinical and administrative capacity. She specialized in critical care, cardiothoracic and vascular surgical nursing. Her specialty qualifications are JCI International Annual Practicum USA, ISO Certificate Course as Internal Auditor 2005, Bulletproof Manager Crestcom USA. She's associated with many institute and society like President, Infusion Nurses Society India US Affiliate, Founder Member Association of Nurse Executive India, Chairperson of Nursing Leadership and Research Committee, Certified NABH Assessor and Nursing Excellence Assessor, Advisory Panel Member at FCCI for National Nursing Reform. She has been crowned with many awards. Topmost Healthcare Leader Award by World Health Congress, Women of Excellence Award by India Achievers Forum, Mother Teresa Memorial Award 2021, Women Achiever Award 2021, Nightingale Award and Torchbearer for Nursing Leadership, Commendation Medal Eastern Command by Indian Army. Ladies and gentlemen, give a huge round of applause for Colonel Binu Sharma.
Namaskar everyone. It gives me immense pleasure and pride to see the nursing at Yatharth Hospital. Yatharth means reality. That means the thoughts of bringing nursing into the healthcare framework to deliver excellence. What I just saw is the vision of nursing at Yatharth. I really fall short of words when I see young professionals, aspiring managers, our future leaders, our budding nightingales, and wanting to do more and more. We all know nursing is not just a job, it is service. It is the most selfless service across the world. We know our pioneer founder, Miss Florence Nightingale, set the tone for us to work. So before I go ahead with the topic assigned to me by Ms. Shinu. Let me thank the organizing committee, the people who put behind this conference into action today and gathering large number of nurses and others to be part of this learning experience. And let me just share a small video. Before that, let me just say, nurses can transform healthcare. If there were no nurses in the world, no patients would have been taken care. We can have a fantastic building, beautiful infrastructure, world-class equipment. We can have doctors returned from all countries, very, very highly qualified. But if we did not have equally competent nurses, equally committed, dedicated, and competent nurses, our patients will not be able to go home with satisfactory or great outcomes. So, ladies and gentlemen, those who are there in their beginning of the career must understand we can transform patient care through our competencies. We can transform patient outcomes through our thoughts and practices of excellence. Do not ever undermine your power and the power of knowledge. I know in today's times we undergo a lot of pressure. This generation is not our generation. We started our career way back. Say, I started mine about 45, 46 years back. Times were different. In today's time, you guys are different. This generation wants to do everything fastest. You don't want to climb step by step. You want to run a mile in a minute. So you want to have your degrees and diplomas. Then you want the first job. Within a few weeks or months, you want to go abroad, and many other things. Times have changed. I do not point a finger at you. This is how the world is changing. So rightly so, you're also changing. But we need to only remember, we are different. Our profession is different. However progressive we may be with the word, however maybe commercial minded you may become, because your needs are also there. But we are the sole custodian for patient safety. Nurses are at the bedside. They care for patients. And if they do a great job, patient goes home safe and sound within the same defined length of stay, without any complications, without any dissatisfaction. He goes home and he leads a further healthy and satisfied and happy life if you do a great job. If you are falling short in your commitment, job, competency, understanding of the medications, you falter once. Patient may not recognize it, family members may not know it, your colleagues and seniors may not know it. Maybe only you just know it. And you can understand the adversities, the errors will lead to sometimes sentinel events. Patient may have a loss of life. Patient may go home with disabilities only because of maybe our ignorance, maybe our lack of thought, lack of time given to a patient. So every single day, every single minute, when you are in the hospital taking care of a patient, give your 100% honest, committed, and truthful care to the patient. You will go home very happy, very satisfied with your career, and you will have a sound sleep. And when you're never going to be answerable to God for something which you did knowingly or unknowingly not right for the patient. So let me just play a video which just takes you back to the power of nursing and what nurses can do through their innovations and through their competence. I hope somebody plays the video for me. Can we have someone here? Shinu, someone needs to play the video. I'll send the video separately also. हाँ. Audio. इसको hold कर लो आप. Just push it back. Yeah. So pardon me for the time the technology is taking. Okay, can you just do that now? Play कर दो. Sound. Is it okay? Can you do that now? Shall I? क्या हुआ? पहले टेस्ट नहीं किया था. प्ले करूं? आप चला दो. So while they are just setting it up, I was saying the knowledge of nursing, the small innovations can actually transform a patient care, can bring in so many changes. I had tried looking for a very, very old video which takes you through small steps by nursing can actually transform. Let's see if they are able to set it up. Otherwise, I'll move on to the presentation if they can't. Let's wait for a while. So while the video comes up, can the audience tell, the nursing audience, what are you looking at by end of the day? 2 takeaways from this theme of the conference. Role of nursing in modern day healthcare. Anybody who likes to answer? Audience on my left. I'm sure there are a couple of nurses. Role of nurses. So communication is the key to managing effective and efficient nursing. If you know everything, okay. Something is coming up. Test नहीं किया था. We did not test it. We tested it. Late. उनको बोलो थोड़ा जवाब. If it is not happening, I will move to the presentation. Just check.
During the Crimean War, more soldiers died from infection than in battle. Until a nurse, introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients, until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand, garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
So you see, this is so amazing, starting with Miss Florence Nightingale. When she introduced hand hygiene practice, we still do it now. And after COVID, we have become so serious about hand hygiene. And earlier it was very difficult to change behavior of people towards hand washing. We have struggled for years together to remind people for hand washing. Multiple signages, charts, reminders, training, alarms at the scrub station in OT, in the ICUs, but nothing worked. COVID worked. COVID has changed everybody's behavior for hand hygiene, what was introduced way back by Miss Florence Nightingale, and you've seen from then on till the very recent time of Ebola, nurses have been able to change things. I think when they took those steps, they did not think of creating innovations, but their knowledge, their competency, their dedication and commitment pushed them to think out of the box. So my suggestion, my request to all of you is, when you are working, don't blindly do your morning, evening and night shift. Think beyond every single day and you'll be able to create a difference. Can I have my laptop for the presentation, please? Okay, let me just move on quickly for the topic, which is empowerment. Empowering nursing through competency building. Competency and empowerment go hand in hand. They complement each other. When you become competent, you feel empowered and confident. And when you are confident and empowered, you want to acquire more and more competencies. Guys, give my laptop. Just set it up. Yeah, charger will have. So what's competency? We've been talking of competency. What is competency? Competency is just understanding your crucial attributes. These attributes are knowledge, skills, abilities and behavior, which are ultimately put in practical application in the real world situations. And for us nurses, the real world situations are patient's bedside every single day, and how effectively an individual can perform the task and achieve the goals is all about competency. In the nursing ward in the hospital, you would be listening to the word competency every now and then. Are you competent? And how are you competent? It's a very common word, a very small word, means so much for the nursing. And nursing empowerment, our second word, refers to the process of developing autonomy, confidence and professional capabilities for nurses so that they can take active role in decision making, critical thinking and overall improvement in the patient management and the overall healthcare system. What is the relationship? I said both of these are complementing to each other. So understanding the significance of competency, crucial for achieving nursing excellence. And empowerment is the key to unlocking the full potential of your competencies. Hence, through empowerment, nurses gain confidence and autonomy to take decisions. They become advocates for patient safety, for providing quality care. What are the advantages? Immense, enormous. Improved patient outcome. When patients choose a hospital, they normally choose it by the reputation and image of the doctor. They look for the best doctor in cardiothoracic, best doctor in orthopedics, so on and so forth. Can we have a day in India when patients will start choosing a hospital also for great nursing care? Can we achieve that? That should be the goal of a nursing head. That yes, in this hospital we get good nursing care, there are trained nurses, competent nurses, they will take the right decisions for us. Hence, that will be a day which is a dream come true and I'm looking forward for that day in our country. So, it will also give, apart from the improved patient outcomes, enhanced job satisfaction. Nobody wants to commit mistakes. Nobody wants to go wrong for patient care. But when you do a great job, you get good satisfaction, you get a great restful sleep. It also reduces burden for the nursing leader and the hospital administrators by improving retention in the hospital and by reducing attrition in the hospital. You got competent nurses, empowered nurses. Definitely you will have a better retention for the nurses. There's a positive work environment. Everybody is working towards a single goal. The single goal is make patients better. I saw, I think in the tagline of Yatharth Hospital, make people better, get better. So who should get better? Definitely patients have to get better. That's why they come to hospital. But nurses should also get better in their professional development, in their competencies. So I think the tagline should serve both our people as well as our patients. Career advancement opportunities, when you're competent, when you're scaling up, you're progressing, you will make yourself a better professional. You will have reward and recognition. You do better collaboration with the team. In a hospital, nursing usually somehow traditionally decides to work in a silo, but times have changed. I know now nurses work in collaboration with all other departments, whether it is pharmacy, laboratory, radiology, customer care, housekeeping, F&B services, and above everyone but doctors. They should work as a team together to achieve our good patient outcomes. Leadership development can only happen if nurses develop their competencies. And I was asking questions in the audience, nobody answered me. So here I come with effective communication. Nursing is a profession which cannot achieve anything unless you have good communication skills. I do not mean a good English American accent or British accent. What I mean is you should be able to understand what orders you are getting from different people regarding your patient. You should be able to comprehend those orders. You should be able to communicate back effectively to patient, to families, to doctors, to all other team members in the hospital. Otherwise, half of the information about the patient may get missed out. And of course, there is a continuous quality improvement. So how do you empower nursing? Through competency building. You start with a great onboarding program. I saw the Excel, train to Excel. So everyone has a good onboarding program. The duration of the onboarding depends upon the hospital policy. You can have it anything between 1 month to 2 months or 3 months, depending upon the quality and experience of nurses you get. If you hire more fresh graduates, you may need a 2 to 3 months program, although during that they work. If you get experienced nurses, they may need a shorter program. So continuous education and training. Clinical competency assessments. Training is not enough and we do not know. You may train people on the job, hands-on skills. You may train people in a classroom. How much have they absorbed? Today's generation is more on Facebook and Instagram. They have very short attention span. So classroom trainings may not really work so well, but on-job training, interactive training platforms, debates, giving them topics to discuss, disease management, and if our respected doctors engage and involve them in disease management and discussion when they take rounds at the bedside. I was in the army for 25 years when I started my career, and I was an ICU nurse for 17 long years. We had about 100-bedded ICUs to manage. We had all doctors, first of all, questioning us, not the residents. They will ask us for the reports, the diagnostic, the symptoms. They will also push us to read about the disease, ask the questions next day. This is how we all learned. I think that's a great way of pulling up your teams, and doctors will really be restful and at peace at home when they leave their patients in care of a competent nurse. You would have seen many times, sister who is on night duty, okay, it is so and so, then it is fine, the patient will be safe. Can we instill that confidence in our doctors that yes, I will let you know well before time when there is a anticipating complication. I will not alert you when there is a code blue, but I will let you know when there is a worsening of the patient condition at the very beginning. I should know how to recognize a hyperkalemia, hyponatremia, or hypokalemia, a abnormal ECG. I should be able to pick up a atrial fibrillation. I should be able to pick up the bradycardia, the tachycardia, and alert the system. That is what the competency will empower you, and that is clinical empowerment. Empowerment doesn't mean that you become a boss and you can give orders. It is clinical empowerment for safe care of patients. A mentorship program, buddy program, or preceptors in nursing work wonders. Every single nurse, when she joins a hospital, must have a mentor for at least 1 to 2 to 3 months time, so that there's a great hand holding. And the best practice is the mentor and the mentee, or the buddies together, or the preceptors together. They are in the same shift for at least 60 days time. The nurses really learn by hands-on how to interact with patients, how to start IVs, how to monitor a patient, how to carry out assessments. Professional development plans or goals should be defined for every single nurse. I saw somewhere again a statement in Chinu's presentation, when there is no goal, you don't know where you are going. Hence, even for a staff nurse level, you're working in an ICU, you need to have those simple goals every day. You will check all the life-saving equipments, the crash cart, the emergency cart of medications, the inventory of required consumables for your patient care, and many such things. But goals must be defined for everybody. Goals must be also understood by the nurses. Not that from the nursing office or HR, you have a goal sheet and you haven't understood and you don't follow it up and you don't understand it. Goals have to be defined, well understood, discussed between the two parties, which is the nurse and her seniors, whatever level of seniors, or HR, whatever is your policy. Feedback and reflection. You may set the goals in the month of April for the entire year. Then you review the nurse somewhere back in the March during the next performance appraisal. The nurse would not have known whether she was doing great, was she committing mistakes, was she not doing right. So a regular feedback and reflection and giving them directions on what is not going right or what are they doing and realigning them again. Just allow me, there is something. So realigning them with the feedback. Use of technology. Today's time is a technology time. And in nursing, there are so many things happening across the globe and across the country. I do not know at what level is Yatharth in terms of electronic medical records or nursing efficiency platforms. But definitely if you want to create accuracy, efficiency, and correctness of the patient records and improve on nursing processes, technology adoption is a great way to adopt. We moved a couple of notches up in technology at my previous organization, Columbia Asia, and also at Max Healthcare, where we've got every single nursing documentation on electronic platform. We've got nursing learning on technology platform. We've got the nursing data entry or through a QR code on the patient's ID band by nurses. So a lot of things you can adopt as you gradually step up, because it's a word of technology all across in healthcare across the globe. And collaboration between team members is a good way to move ahead in a hospital. Focus on wellness and burnout prevention. Yours is a new hospital, there may not be pressures, but as this hospital becomes a 400, 500, every department becomes busy, all doctors are operating, theaters are busy, ICUs are filled, you will start having staff management issues, nurse-patient ratios may get skewed, there will be burnout, there will be stress, there may be overwork, and that is part of nursing life or part of healthcare. Doctors also have a lot of long hours. Everybody in hospital has long hours, but you must find ways and means to tackle with stress and burnout. On continuous education and learning, everyone knows this into the nursing world, into the healthcare world. You've got a great nursing leader, Sheenu, who herself can take all the right steps for training. But what you must remember, training and learning is a lifelong journey. When you are a staff nurse, you need training of a different level. When you are a team leader, supervisor, a manager, a nursing head, a CNO, a director, at every single step, you need training. I just have to say one thing here, that in nursing, the more we become senior, we move away from patient care. But when doctors become more senior, they move closer to doing more complex work. This must change in the nursing world. More diplomas, degrees, professional certificates you acquire, you need to put all of it back into nursing practice. You need to be in the patient care area, spend time there, train your juniors, ensure patients are being looked after. You've done a master's in OBG, put that into practice with your OBG nurses. You've done a master's in critical care, spend time in the critical care. You can't just focus on administrative work. We need to change our mindset. All these steps required for education and training should be taken. There are so many things written here: in-service training programs, recognition for doing good training, participating in conferences like this, getting exposure to specialty program, super specialty program. It is a lifelong journey. As long as you are a professional and you are engaged in patient management in the hospital, you need to go on learning, because the world of healthcare keeps changing. The way you do surgery now has changed. There are robotics, there are different equipments for surgery. So we have to go on adopting newer and newer things. Medicines are changing, antibiotics are different, so many equipments are there, so many smart pumps and multiple things you need to keep on adopting. Hence, learning must go on. Clinical competency assessment, this is something when you come and start your career wherever, whichever hospital, here or anywhere else, you are at a different level of competency. There should be a tool which is a simple one for nurses to understand, where they do a self-assessment that this is where I stand. That can have some 20-30 points. And then they are also evaluated by a senior educator, supervisor, whoever, they are evaluated, and based on at what level they are, as per the competency tool, whether they are novice means brand new, fresh graduates, fresh diploma holders who have passed their exams, but they do not really have the hands-on experience or patient experience. From there, they may move to a beginner where they just start developing, then they become competent, and then they move to expert. Expert can supervise care along with the newcomers. So this is a Banner's competency tool theory, novice to expert. You can define your own, whichever way you wish to define. I've just put in one sample of a competency assessment tool, which I follow. This is for a liver transplant ICU nurse. For the job role the nurses are doing, you need to develop a different competency tool specific to that specialty, specific to their role. A nurse working in the operation theatre assisting orthopedics, and a nurse working in a liver transplant ICU, or a nurse working for a neonatal ICU will have different competency tool, different skill set required, and different trainings are required. We can't have a single stroke for all specialty nurses in the hospital. Mentorship program, we all understand the benefits of this program. Assign a mentor. Mentor should be formally oriented and trained to do what they're expected to do. Reward them for taking that extra burden of training nurses. This program works really wonders. I do it for about 3 months' time for the fresh graduates and 30 days' time for the experienced nurses when they join us new. And I've seen a lot of benefits from this program. Professional development program, everyone must have. Nurses always look at what is in it for me. After being a staff nurse for some time, they look at what next I should add. Hence, for everyone, there should be a clear understanding on how you can train yourself. Either you can grow vertically, you can grow into a specialty, you can grow into a clinical educator, hands-on training job, or different roles. But every single nurse for competency building must have a clearly defined professional development plan or succession plan in the hospital they work. Feedback and reflection is important, whether they are into patient care areas, on how they are doing, what mistakes they are committing, where they need a targeted training, are they poor in medication management, are they poor in infection control practices, are they lacking in the protocol for assisting doctors for various procedures, whatever is that, or the hospital information system. But give them feedback, give them reflection. Only thing to be reminded here, we should not take a punitive approach or a punishment approach for nurses. They would not complain back. They will quietly exit the workplace, go and join elsewhere. No punishments. Punishment is not the way to develop a professional. You have to sit with them, counsel them, make them understand, and try to support them or mentor them. Use of technology helps in so many ways. Electronic health records, learning platforms, various dashboards. Nurses need not spend their valuable time in managing those registers and forms. A lot of things should be automatically pulled in from the hospital information system. Nursing time is very, very precious. You need to spend more time at a patient's bedside. We carried out a time motion study where we saw that nurses were spending only 30% time at the patient bedside for care. 70% time was going in many other activities, managing inventories, logistics, documentation, going to pharmacy, and doing so many unwanted activities which somebody else could take on. But the time spent at the patient bedside was only 30%. Need to think of it. When your hospital gets busy, you may want to adopt a few things to save the nursing time and non-nursing activities. Leaders develop within the hospital. Sometimes a nurse with 4 or 5 years experience becomes a very effective and efficient manager and leader. Do not keep your mind closed. Somebody with 20 years experience, gray hair like me, only can be a leader. A young leader with fresh thought, fresh way of looking at patient care and mentoring can become a leader. So open your mind. Do not go by the hierarchy system not anymore, not in this word. Quality improvement, target your areas where you are struggling and have. I saw a QIP presented by Shinu on simple rejection. They found a issue with lot of rejected samples from the lab. Maybe the quantity was insufficient, maybe it was hemolyzed blood, maybe it did not get transported on time, maybe wrong vacuoteners were used. Whatever is your area of improvement, define it, give it to the young nurses to make a framework, give it to them, let them do it. We need not impose our directions to them. If a SOP has to be done, give it to the people who are responsible for actually practicing or working on that SOP later. We in the nursing office need not develop the SOPs. We can sit with them once they come up with the first cut or the draft of that. Wellness and burnout, we can have a one-day conference on that. Nurses need stress management, yoga sessions, some therapies, some dance, some diversions, something to keep them diverted once in a while at periodic intervals so that they do not get work pressure and burnout. Many of them are away from their parents, spouse, children. They live in isolation in PGs or in hostel. Social environment, networking, emotional support to them, having a counselor, a helpline where they can go. They need not confide in everybody, but they can reach to the right person. Promote healthy eating habits, a good body, healthy mind, healthy body, annual health check. Support them, recognize early signs of stress, and create a very, very nice, healthy and positive environment where people genuinely look happy at the workplace. It is always said people do not leave bad organization, they leave bad bosses. So let's be good bosses. Let's not be bosses at all. Let's be friends and colleagues. In conclusion, empowering people through competency is pivotal for creating a resilient, efficient, patient-focused workforce which stands shoulder to shoulder as a partner in care. And thank you everyone for listening to me.
Thank you, ma'am. Your words have surely sparked our imagination and ignited a passion for exploring new frontiers. Thank you, ma'am. Now we have a very famous and inspiring personality with us, Dr. R.K. Mani. And to welcome him, I invite Dr. Neena Tyagi, Director of Yatharth Hospital and Trauma Care Hospital. I'm so sorry, Yatharth Hospital and Trauma Care Service Limited, and she's also the head of the Department of Gynecology and Obstetric. Please welcome ma'am and sir. Please come on the dais, ma'am. Sir, please come. Thank you, sir. Thank you, ma'am. As we move forward, let's acknowledge that this conference is not just about listening to great ideas, but also about engaging in meaningful discussion. So it's time to deepen our conversation with our upcoming panel discussion. Our panelists are Dr. R.K. Mani, Colonel Binu Sharma, Ms. Josephine Cyril, Mr. Abednego Peter Johnson. They will delve into the topic nursing retention strategy and encouraging flexible work culture. Requesting Ms. Shinu Varghese to moderate the panel discussion.
एक हटा दो, एक हटा दो. क्यों? चार ही बैठेंगे सर, मैं नहीं बैठूंगा. नहीं बैठेंगे? नहीं. माइक दे दो बीच में. गजेंद्र बोर्ड लगा दे, बोर्ड लगा दे. I would request all the dignitaries to please come on the stage. I think I'll come in the center. Or I should sit. नहीं वो सेंटर आ रहा है ना.
उसको टेबल को इनके सर के सामने कर दो, ऐसे पास में, ऐसे नहीं.
तोड़ दो. Okay. So first I would like to take the opportunity to thank Colonel Binu ma'am, Dr. Mani, Madam Josephine Cyril and Abed, who have taken out their time from their busy schedule and come here to discuss about a burning topic which everybody is facing across, I think, the world, not only India or Delhi NCR, it's across the world which we are facing. That is the retention strategies and flexible work culture, how we can work on it and make life easier for the nurses. So my first question goes to Binu ma'am. Ma'am, what are the benefits of retaining a nurse and how does it impact the organization?
Thank you, Sheila. I think you rightly said a burning topic. Every single private hospital, to start with in India, is struggling with attrition. The attrition is as high as 50 to 70%, and I know of some hospitals who are more than 70%. You said, what are the benefits of retaining a nurse?
Yes, ma'am.
Imagine you hired 100 people in a year. 70 have already moved out for whatever reasons. You would have replaced with another 70. The exercise of onboarding, training, developing nurses for safe patient care, it takes actually years. And here we are talking 60-70% people moving out every single year from the private sector. It's a Herculean exercise for the nursing department to replace, for the HR first of all to get the right people, then for the nursing to develop them, then for the doctors to have confidence in them. As a nursing administrator, you would be always listening from the doctors, why is my staff leaving? Why are you giving me new staff? And we hear it so often. A nurse, when she is retained, developed well, knows the protocols, the procedures, the policies, knows the culture of the organization, knows her job well, is the right person to deliver safe patient care. Hence, a hospital must take every single step to retain nurses, although I'm sure you will ask how do we retain them and where do we lose them. So we lose them to the entire globe. Within India, you may lose them to competition hospitals, but more than competition hospital, they go for government jobs because they have a secure life, safe life, better compensation package. Government gives them about 2.5 times of what private sector gives them. So why would they not go? No pressures of NABH, JCI, etc., and a set routine. Medical care taken well for self and family. There's an accommodation. There's everything. Private sector, we all struggle with a lot of these privileges for nurses. Hence, nurses choose government jobs. And thanks to our Honorable Prime Minister and the political leadership of this country, more and more government Hospitals are opening, more AIMS are getting created in the country, more beds are opening up in the public healthcare system, hence more job opportunities for nurses. And if they don't go to government jobs, they go overseas. We have Europe, UK, US, Middle East, and everything else open for nurses. So that's where we lose them. We are the third choice for them. So unless you do really wonders, will be difficult to train them, but it is so crucial to train them if you want to stabilize and achieve patient care standards in your hospital.
Yes, ma'am, that's so true that we put in so much of efforts in building a nurse and then they just leave us within 6 months to 1 year. So what about your comments, sir? Would like to hear from you as a clinician.
Yes, I've been a clinician as well as an administrator and in grips with these problems, very problems, attrition, and it's always been heartbreaking for me to see a well-trained nurse leave. See, I think the crux of the matter, yes, we have competition from the government sector, from the military, from elsewhere, but I think even all this has not taught us how to value our nurse. I think the crux of the matter is we don't invest enough into what is most valuable. So we think it's replenishable. You don't see it as a specialist person who is more than the compensation that you're giving. All right. So if you view it like that, I think you would set the value differently in terms of compensation, in terms of work conditions. I think we have to learn qadar kaise karte hain, theek hai? We have to learn that, and if we do that, everything else will follow.
Dr. Mani, you have so rightly said.
Rightly said.
We go all out to invest in specialist and super specialist doctors. We want to get the best. When it comes to nursing, we do get good ones, but we do not do enough to retain the best talent because we think we will be able to replace them. And believe you me, we always end up replacing our most well-trained nurses by very, very novice and beginner nurses. That's the ground reality in today's time. Yeah.
Yes, sir. Madam Josephine, being in a semi-government organization, you can put some light on this topic.
Yeah, thanks Shinu, and good morning everyone. So talking about myself, I had the privilege to work almost 30 years in corporate sector, and in that around 14 years abroad, and now in trust and private hospital, last 3 years. So I can really feel the difference. Exactly, I agree with all of them, what they said. The retention of nurses, what you said, the benefits are enormous. I can't even limit myself into words. Number one, if you have nurses staying with us for longer duration, well-trained, skilled, competent, everything, all adjectives you can add to, the organization really shines. Every organization, the management is looking at only one thing, quality patient care. I'm sure all of you agree with that.
Agreed?
Agreed.
Awaaz nahi aayi.
And quality patient care comes from people who are well-trained, experienced, and staying with the organization for longer period. And number one thing, when, the investment in nursing, what Dr. Mani said, even today our government hasn't understood that. If nurses are leaving, I had done a study in my last private hospital, 1 year, 2 months is the time a nurse stays with the organization. And we had around 550 nurses, 70%, 60 to 70% was the attrition. Almost every day, half my day was going for recruitment. And my nurse educators, myself, into recruitment. Imagine your precious time is wasted in preparing questions, lot of paperwork, time, energy, man, money, material, what we learned in the MBA syllabus, you are wasting there for recruitment. But with the current organization, I can tell you, the beauty of having people staying with us with attrition less than 1%. Benefits are many. Number one thing, the nursing head tension is less. You know, the nursing head become little more complacent because she knows that people around her are so happily working and they are well trained. They can take pressure. If there is any kind of thing happening, whether there is a medical issue happening, whether there is a patient complaint happening, they are equally competent like you and they are concerned about what's happening. And a nurse who is retained for longer time feel valued in the organization. She feels there is a value for her and she feels she's working in a family environment. And at the end, who is the beneficiary? The patient. The patient is getting cared by very committed, loyal, trained staff who knows the culture of the organization. We nicely show the vision, mission, core values of the organization during a accreditation opening meeting. But frankly speaking, exactly that is ingrained and passed to every employee in the organization who is staying with the organization for a longer period of time. And that's the beauty of retained nurses. And overall, your expenditure, your cost will come down, your attrition and your recruitment process investment will go down, your time you can spend on, strategy planning, creative training, more opportunities for nurses to come up. Your mind will work because you have ample time. And the patient satisfaction will go up. Frankly speaking, you will not require a marketing department. You will have patients going out and telling 100 other people, this is the hospital we must go to for patient care. I think that is the message what I want to communicate from nurses who are in the organization retained for a longer time. Thank you.
Thank you, ma'am. Very rightly said. The patients who go out should not be saying, I am coming to the hospital because of the doctors. We will feel proud if the patient says that we are coming because of the nursing care provided from the hospital. So, Abbott, being a male nursing administrator, please share your thoughts with us.
Thank you for that. I think major chunk has been covered. My elites have already said about the same thing. But yes, to hold on a nurse will improve the customer satisfaction. It also gives a team satisfaction. It also gives a confidence in the clinicians and the nurse leaders. It's like a nurse who is leaving an organization. It's like a vertebrae moves out of the spinal cord. So when it moves, the whole setup shakes off. Now, there's an old saying which already stays back, that to save a penny, probably we are spending rupees about it. So probably a nurse is leaving to a nearby or a neighboring institution for the little progress or a promotion or probably little handsome of money. But we are saying her goodbye, giving her a great farewell and saying she is a great part of our team. You can come back to my organization anytime. My doors are open, my windows are open, my computer is open, my mobile is open, everything is open. She says goodbyes and she joins a nearby institution. But what makes a difference is that, as leads have said, that putting a lot of money behind training a new nurse. And once she starts working also to get a confidence in her, and once she gets a confidence, or we start to get a confidence on her, she also goes in the same way what the other girl is left. So it is very important, what the sir has said is that we need to always pick up the best ones. The creamy people should be acknowledged, applauded, and should be retained. That's how it should be.
Thank you so much. I would like to add to it that I think when the nurses are hopping from one hospital to the another hospital, they don't realize that they are actually making hurdles in their life and their career growth. Do you agree with me, ma'am? Because you are putting a lot of effort in jumping from one hospital to the other, but there is no stability in one department and one hospital. So
in today's time, 10 years of experience, 12 or 14 different hospitals a nurse would have worked today's time. For me, 45 years of experience, I worked in 3 organizations. That's all. Can we move to something like that? Because ultimately, patients, hospital, everyone values a nurse who once have been trained, stays there, gives back to the organization where she got experience and training, and you can grow within the same organization. There will be opportunities. You may have your own points, but at the same time, the hospital administrators, owners in the private sector, they have to change their mind to that nursing is not a cost. Nursing numbers will be always 60% of the total hospital workforce. 55 to 60% are nurses in numbers, but they are not a cost. It is because of them your patients will go back home without complications, with good outcomes. They help you create the image of the organization without any spends on the marketing to get the patients. As rightly said by Josephine, and I also mentioned in my presentation, there should be times when patients come to hospital for great nursing care. Ultimately, after a great surgery by a doctor, it's the nursing care which matters. You are the ones 24/7 with the patient. Doctors spend very limited time. So it should be the nurses for whom patients come back to the hospital by word of mouth, not by marketing and sales department. So let's create that across all private hospitals.
Thank you, ma'am. Thank you. So I move on to my next concern, that is the pros and cons of the retaining nurses on monetary basis. Somebody says that I've got so much of hike in another hospital, so if you give me this much, I'll stay back. So what are your comments on that, ma'am?
Okay, that is a daily affair. It's not just nurses. It is all employees in the hospital who come to you that I have an offer from another hospital. The offer is 20, 30, 40, 50, 60 to 100% hike. What does a nursing leader do, or what does an HR do? It's a very, very difficult and complex situation. There are no black and white rules for it. If your position is highly critical, you got a nurse working in a neurosurgical operating theater, and she is the guiding force in that, and your neurosurgeon cannot really handle the theater without her. You will have no option but to retain her. Likewise, if you have a nurse in the oncology, you have a nurse in many, many other areas of the hospital. But what happens in this exercise, if you have retained one person for going all out and changing the monetary cycle, you will have 10 more people coming to you in the same month. Hence, in the long run, it doesn't work at all. You have to find different ways of retaining people with today's times do not have a legal option of a contract with a hospital and things like that. Earlier even those things were there, but then it did not work in the private world, and no contract signing is allowed by the hospital and the employee. I think you have to motivate nurses, give them professional platforms to grow, and your monetary increase should be not based on just experience but based on their performance. And you can put some subjective elements when you change the monetary, that we give you more responsibility, hence we may increase a little more money, but for the same work what others are doing and only one person you single out for giving a 30-40% increase, it does not really work in the long run in the hospital. Others will come and follow the same route.
Thank you, ma'am. I also have the same thoughts. Sir, what about from Dr. Mani, I would like to hear.
See, I think there are some environments, what Josephine said, she has a very low attrition. And similarly, CMC fellow. They don't pay high. I spent some time with them understanding how they run. Now, I think the work culture and the nurturing is foundational. But you see, in a system, in the private sector, you have to make exceptions for exceptional talent. You can't have one glove fitting all, and that sort of culture is also not good. Then everybody is up in arms if you raise for one person. I think that should be discouraged. But where you detect talent, I mean, paying higher is okay by me. I think that culture is fine. But I think if you have an overall ecosystem which is supportive, less and less people will go only for the monetary consideration. That is the unspoken thing. You're going for monetary consideration, because that becomes for you more attractive if the rest of the ecosystem isn't supportive. I would focus more and more on the ecosystem, then it will sit properly. Even if you give a modest increment to somebody in a specialized way, that will work as an incentive rather than a disincentive or as a focus point for conflict. Yeah.
We've also seen people leaving for better money, and within the next 3 months they want to come back because the culture at your place is better, the learning environment is better, they get more time, fun activities, diversions, they get flexi hours, so they come back. This culture I've seen, and for the last 1 year, we've at least hired 130 people who left us and went, and they've come back to us. So I think work culture, Dr. Mani rightly said, work culture, positive environment, team culture, an environment which has no stress, works wonders back. People will come back to you. Only money does not work in the long run.
Rightly said, ma'am. Ma'am, your comments?
So, I'll tell you my experience. An example, one of the guy who worked with me, an excellent nurse, and I really wanted to keep him for many years because he was that good in his work. So just like, as Shinu said, he came, he said the salary is not up to the mark. So we sat down with him. He's a good performer too. Naturally, performance overweigh than the number of years. I totally agree with what Madam Binu said in the presentation. So we increased his salary with a very good jump, and he stayed back. You won't believe, in 6 months' time, with the revised salary, he got another jump of 40 to 50% and moved to another organization. So that is the sad part of it. That whom to trust. We really want to look at if somebody is a good performer, and genuinely we have to relook into this, whatever pay package the person is getting. But which situation we have to believe that he is going to stay with us for longer years. And the people who are going also, they spread, sometimes wrong information outside that you go, you fight for it, and you will get it. And then nursing is such a large team, 60% of the employees are nurses, and it spreads just like that. So fairness in decision, especially when it comes to giving a jump in position or giving a rise in the pay scale, has to be done with a lot of thinking process, and taking many factors into consideration. One challenge as nurse administrators in private organizations they face, today clinicians move with their entire team to a new organization.
That's become a trend now.
And the team comes and they come and say, my team, my nurse will get this much salary. And the existing, the same department team members are at a much lower package. It becomes so difficult for the human resource department and the nurse administrator. And finally, when they are on board with a higher jump, people in the same department working with a lower scale, it is such a negative environment. In fact, creates a negative culture in the workplace, work environment. So I think this point needs lot of thinking, and I think we should stick to one thing. Let's practice what is the most apt in the organization, being a fair, decision maker, so that nothing goes bad, and then again it will come back to you with multiple, negative views by many people.
So I agree with
that's
you,
my comment.
Josephine, on this. We have had multiple examples of people getting their salary up in a year 3 times and ultimately moving. The present organization where I work, they have a clear-cut policy till the performance appraisal time comes, the annual performance appraisal, they will not change salary. They will call you, counsel you, give you the promise. At that time, based on your performance and aspirations, we shall revise it. Till then, you will have to continue working. This works better than taking crisis management calls. So they do not usually take those calls because it disturbs the whole nursing cadre and the people moving with the doctors were difficult to handle. We go through it very, very frequently. Yeah.
Thank you, ma'am. Abid, your comments and share your thoughts.
Well said. As I come in the last, so I get a complete chunk of things has been shared. So I do agree with whatever Ma'am Binu says, Dr. Sir is saying, and what Madam has said that the payment doesn't solve the problem. So what we do is that we keep an average of growth for that designation, and we never jump over the designation. And we also study the before and after what ma'am has said, that how much a person can stay back, or how much he can be or she can be useful to us. So like those things we consider with this and we can move forward. But as an administrator, what I feel is that little jump is okay for the nurses. The reason behind that is nurses will appraise themselves, or they will improve their living, and they will improve their collar by earning more only. So, I mean, as an administrator, we should not close down the doors that there is no growth. We need to open little windows at least, so then we give them a little hike, we keep them happy, and as a overall, as a nursing thing, we just raise our whole stage to a limit that it says that, yes, we are the people with other professions in aligned on the left and right side of us, that we also take a handsome sum of salary in our house. That's how it should be. That's what I feel. So
definitely, Abid, what you've said is absolutely correct. We need to raise the bar for the nursing, but not in tits and bits is what I feel. It has to be, like ma'am said, as a performance appraisal, and accordingly it should be done, and people should be loyal to the organization. Money is not always, money should not always be a priority. It should be the work culture and the job satisfaction which takes you to a long way and long run. That's what I feel. Thank you. So now I'll start with Abid. How can we provide flexibility in the work culture for nurses to be more productive?
Wow, this is the latest trend which youths wants it, and probably a future generation which requires that flexibility in everything. So they'll be very happy for our administrators as we close our eyes and we walk and we say you are perfectly done and what you're doing is perfectly fine. But that's not possible working in the private sector. And we just go with the customer satisfaction a lot. And we do a lot of ups and downs. For example, like a nurse comes that she changes her shifts. She says that for a month probably I want to go for studies, or I'm doing something in a certificate course. I just want to have a only general shift. I don't want to have a break shift. So we can just consider saying that how much she'll be fruitful to us in between. Someone says that my daughter is there. She has come from abroad and she has a kid, so I need to be there with them. So small happiness which a nurse administrator can give to a nurses as a token of love and a satisfaction for her heart full of service to us. That's going to give her really a flexible work culture to the nurses. And probably it is just a one biscuit which we are giving to them, but they'll be fruitful for the whole packet of a biscuit. So that's how it is. And also, this also has a wrong points, as we discussed in the previous sections, that they can misuse this with a lot of other nonsense talks, everything. But I think nurses always, as my seniors in the Max Hospital, they all say, please solve your problems of your house in the house. I am here to solve the problems of the hospitals in the hospital. The usual dialogue what the NS says. So, like those things with those walls and the gates and the constrictions, we can go forward with that. So, this is a very good thing. The culture of working should be very relaxed. They should feel very happy. I think nurses cannot take that part of it, but in foreign countries, even they have a nap period itself. So they can go for 1 or 2 hours, they can take a small nap, and they can come back, and they can bounce back with double the energy what they have. So I really, I'm for it that I'm just go for it. Thank you.
Okay. Thank you, Abid. Now we'll give not one piece of biscuit. We'll give a packet of biscuit to everybody. Yes, ma'am.
Yeah, this is a very important question, flexible work culture. I think today's time when nurses are coming for interviews, that time itself they are mentioning about their inability to do night shifts. Many nurses tells me that my husband is traveling, he comes home by 12 midnight, he is in the hotel industry, he works in the call center, very erratic working hours, and there are so many single mothers. Either they are coming from a, either divorced or not living together, husband is working abroad. I tell you friends, if I draw a graph, hardly I heard such requests when I was a beginner in nursing administration. But today the requests, even today, I have made a separate folder only for all these requests, for requesting for flexible working hours. I have almost on board now 1400 nurses, and at least 50 of them have requested for straight shift. It is such a difficult, thing to decide and take it forward, because we want, genuinely speaking, every nursing administrator want their nurses to be happy. And as he said, we cannot tell them that you solve your personal problems at home and you come and work efficiently on the job. Impossible. If you are personally happy in your personal life, you are a good performer on job as well. I think your personal life matters a lot. So I think every nurse administrator has to think how much they can do that little adjustment. Maybe for a month or two she wants a straight shift. Maybe there are areas we can identify where they can be posted for straight shift. Maybe somebody who is looking for an evening shift and night shift. Maybe someone is more interested only in night shift, or someone wants a 10 to 6 shift. Those kind of adjustment, how much possible, whichever department it is possible. If you have a long list of requests, we have to justify who deserve it first, and we should consider. And also for pregnant women, with a lot of work at home, as an Indian wife, mother, once you reach home, you cannot say you were working in a liver transplant theater, scrubbed for 14 hours. You are again a wife or a mother, you are back to your kitchen, back to your kids, and the expectation from the family is so high. So you need to understand and give them offs whenever they require. And I think flexibility has to be more in considering their request, though it is not possible in all the 100% of cases. And also flexibility in the posting of the areas. Though somebody is very competent in critical care, due to ill health, due to lack of mental capacity to concentrate, or maybe on some medications, flexibility again comes there, which has to be explained to other colleagues so that they also understand why we are doing that kind of a adjustment, so that there is fairness in the decision what we are doing is known to others as well. I think this is a topic which is very, very important today, because as time is changing, healthcare is changing, the issues in family are also increasing. I can see nurses going through depression, anxiety, and so many physical disorders, health issues, hypertension, diabetes, seizures, so many health issues youngsters are facing today. They have no passion in life, they feel frustrated, they feel lost. They someday put their negativity in the WhatsApp status or in the Twitter. So it becomes a huge challenge for nurse administrator to consider this, but we need to look into it.
Thank you, ma'am. Thank you. So,
I think I've heard two very caring administrators, and Josephine, and it's very heartening, because flexibility actually is the hallmark of a caring administration, right? And it is actually it is inherent in an ecosystem we've been talking about, a cultural system, where there is some recognition of the person, not just as a pair of hands, okay? And it's extremely important. So many different scenarios, Josephine enumerated, and they are all real. They're all, straight from the reality picture. If we can't have a dialogue, then that means the system is too rigid, and then it goes by the rules. So there are only rules, no soul. Okay? this is not the way we develop people. You know, we may train an individual, go through the process of teaching them skills, but developing a person is something else. I think Binuji has also mentioned development. I was very pleased to hear this. Music to my ears. She didn't talk about training. She talked about developing. Exactly. That's what I also want to do as a senior person to my juniors, that you want to draw the best out of them. For that, we need to give something. Put in something, then only we get something back. Putting it in is you care for the person, which means you care for your problems. And then you try and work around what is possible. You may not achieve 100%, you may not go all the way, but even if you go a little way, it assures the person that the person is being heard. And they are not only thinking of what to do in the next duty, they're thinking about how they can get the best out of me. And I think that investment is very, very important. Sometimes we have the fear that we could get conned by people's excuses, but that's a risk. It's okay. But that's okay. You win some, you lose some, but overall, I think you create a position of trust. It draws the best out of people.
Thank you, sir. Ma'am?
Just I want to add one thing. Today's nurses, this flexibility, they just want the nurse administrator to spare little time to listen to them. I think that's what they are looking for, little time. You give me little time. I want to talk to you. I think that little time sharing with your subordinates, a true leadership comes. You listen to them. Their half the problem, even 80% of their problem is solved. They feel you heard them. Whether you solve it or whether you will find a 100% solution to their problem is secondary. At least you listen. I think as administrators, today's time, the young generation, they want us to listen and a little bit of counseling. So 30 to 40% of our time in today's time goes in counseling, making them understand how to handle the situation and how to go ahead in life. Thank you.
So, listening to everyone, lot of thought. So I would just attribute with one sentence: care for caregivers. We nurses are caregivers. If we are not cared for, that too in today's time when we have nuclear families, husband, wife, managing one or two kids who go to crash, who go to school, they fall ill. If they come with special request, they may be pregnant, they are lactating mothers, they have no one at home, husband traveling, multiple scenarios. Their health is not okay. You cannot go by the rule book. Earlier, we did not really have these kind of requests. Till about 10 years back, I hardly used to come across a few requests where people want to take a 4 hours break, a 2 hours break to go and attend the parent-teacher meeting or to go to the bank, etc. But now there are more requests that I need to be spared from night shift, or I want only night shift. I have requests where people say, I just want the night shift because my husband works in the day and he'll be there at night to manage the kid. We don't have anyone home. Suddenly your parents or your in-laws are not there to support you. Their health is not okay, or they have moved to another state. All of these requests are very, very genuine. If you want your team to stay loyal for life, win them with these small things. Give them a patient listening, definitely goes without saying. Our young nursing administrators quite a bit go by the rule book. नहीं मैडम अकेले किया है तो हमें सबको स्पेयर करना पड़ेगा नाइट ड्यूटी से, ऐसा नहीं होता. Not everyone needs those support at the difficult time. People go through difficult times in life and those are phases. Those are not permanent ones. Give them a patient listening. Talk to them, okay, 3 months, 6 months, कितने दिन support चाहिए? What you want? Okay, we will do it for you this way. You want a change of department? Can we move you to a straight shift? Can you move to OPD? Are you stressed out? Okay, we'll give you a break. I have given flexi duty as a policy about 10 years, 12 years ago when I worked for Columbia Asia Group. For the first time, when I suggested it in the boardroom to our CEO and group medical director, they said, nursing में flexi hours भी होता है? I said, क्यों नहीं हो सकता है? Nurses are human beings, and that was the time I came up with the tagline, let's care for caregivers. We started officially flexi duties. There were nurses who will come for 4 hours in the morning, then they want to go pick up their children from school. They want that break till 4 p.m. So 1 to 4 p.m. they'll take a break, and 4 p.m. they come back and they work till 8 o'clock. All of this we actually did. It did not disturb patient care. It added more positive environment. People became loyal. They didn't leave us because that organization was giving them flexi time and patient listening. Definitely it creates a happy workplace, and I strongly recommend and believe in flexi hours, flexi time and flexi policies for nurses.
Thank you so much, ma'am. Thank you.
And HR is always advocating. Most HR policies always advocate all this positive environment. Definitely in the policies and on paper. You as nursing heads must push that our nurses are taken care all the time. If they are taken care, they will ensure your patients are taken care better than you take care of them. I read a book long time back. It was not customer first, it was people first. I picked it up at one of the international airports, and it attracted me because all the time you read customer first. I said it says about people first. I forgot the author right now. It was an eye-opener somewhere 2010 or 11. I read this book. It just says make your people happy, take care of them, forget about everything else. They will make your patients and your clients or your customers happier than you make them happy. So that's the thought.
Thank you, ma'am. I would not take much time, but I want to share a small reality which I had faced, and I want a comment from all the administrators sitting here. The story is that, yes, there was a boy who was there with us, and we had given him hike of salary from the organization. He had been interviewed and got selected. The same salary we gave him here. And after a month, he said that he wants leave. That was also given to him. And after the leave, he did not return back to our organization and joined the hospital where he was posted. He was interviewed for. So what, as an administrator, what are your thoughts on such kind of staffs? How will you trust them?
Forgive and forget such cases. These are not every day. People do make mistakes in life. Do not keep the grudges against them. I'm sure he would have had some of his reasons which he can't explain to us. It happens many a times. My policy is forgive them for whatever they do. They have self-realization. They come back. I have numerous examples of people who took this route. They stayed back. They went back to the same organization. They took a 1 month salary at your place, went back there. They told you mom has expired. I need to go back to hometown. They're working in another hospital. That's all right. Forgive people for their mistakes. Life is too short to keep grudges against people, especially against your juniors. Give them love and compassion. They will be with you sooner or later.
Shinu, I have one story to tell you to add to that.
Yeah.
I had a male nurse, male brother. He had around 3 to 4 years experience at that time. Exactly what Shinu had experienced. He was posted in HDU department. He stayed for almost, I think, 4 to 5 months. So hardly any interaction as a nursing head with him. But I know I have recruited him on board. One fine day he is absent and he disappeared. So that means he left to another organization. You won't believe, after almost 5 to 6 years now, I was doing assessment in one of the hospital in Punjab as a principal assessor, and he was the nursing head. And he left our organization within 4 months' time, and he was doing a great job over there. So a question mark. It is their decision. They want to stay with us or leave us. bless them, forgive them.
So I really thank Colonel Binu, sir, Mani sir, Josephine ma'am and Abbott for a very interactive and knowledgeable session out here. And I hope everybody has got a learning from this panel discussion. Okay. Thank you, ma'am. Thank you, sir.
Thank you so much, dignitaries, for such a fruitful discussion. Now I'm inviting Dr. Amit to present the memento to Colonel Binu Sharma as expression of our gratitude. Ma'am, please come.
Hello.
Our next speaker needs no introduction. Today, we are indeed honored to have an inspiring personality, the very famous Dr. R.K. Mani with us. Sir has left an indelible mark on the field of critical care and pulmonology. Dr. R.K. Mani holds the post of Director of Clinical Services, Yashoda Hospital. Sir is widely regarded as a pioneer in the field of pulmonary critical care. A former president of the Indian Society of Critical Care Medicine, he was the chief editor of the Indian Journal of Critical Care Medicine. His seminal contribution towards the development of end-of-life and palliative care in India are widely acclaimed. He holds more than 30 years of experience in the field of medicine, pulmonology, and critical care. During his career, Dr. Mani was associated with Indraprasth Apollo Hospital, Fortis Group, and other reputed names in the healthcare industry. Dr. Mani has to his credit a number of research publications and book chapters. Dr. Mani is a name to a reckon within pulmonology and critical care. Mani sir, now this dais and audience both are waiting eagerly to hear from you. The topic is nurse interface between clinician and patient. I request a hearty welcome to Reverend guest Mani sir with a huge round of applause.
Thank you for a most kind introduction. I have a set of slides. Are they on? Wait a minute. Maybe there. Is there some help? Yeah, there's a set of slides. Actually, it starts from there. So this is the crux. How does the nurse and the doctor, how do they work together, or how do they function or not function properly? Because the two together are greater than the sum of the individual parts. And if they are not together, they make a mess of the whole thing. So let us see how we have evolved in this relationship. Are we getting the slides, or I'll speak out? Or if they don't have, I have my. Oh, yes. There it is. Oh, that is. If you don't have the slide, then I'll give you. There it is. So can we? So can I control it from here? Is it possible to control from here? Or? Yes, sir. Yes, sir. Back. Just go move on, huh? Yeah. So, oh, sorry. There we are. This one, no? Yeah. So you see, This was more than a century ago, this was the attitude. All right? I'm ashamed of this attitude by medical forefather, MacGregor Robertson. Typically British. They consider the nurse as not an independent agency, but just as a conduit, an instrument for the doctor to look after the patient. So this, unfortunately, it may be more than a century old, but this is the mindset still prevalent amongst many of my colleagues. And I have spent a good part of my career in militating against this because this is extremely regressive, and this is what has held the relationship back. You know, the attitude is, I'm mentioning this only to discourage it. But the equation happily is changing. I can see now there are nursing leaders amongst us, and many in the audience, budding leaders, nursing leaders, and they are changing this equation. You know, the equation has been one of an unquestioned dominance and a lot of paternalism, and this sort of paternalism even the patients have borne for many decades before they woke up. And now this awareness is increased among the nurses. There is the nursing as a specialty in itself, bringing value by the bedside, very different from the expertise of the doctors. So they are not conduits, they are agents, independent agents. The first and foremost thing I want to tell all the nurses, you are independent agents in the care of the patient. We come together as equals, as a teamwork in the care of the patient, and the hierarchy which we have accepted so unquestioned way for so many decades, we must shake that hierarchy, make it as flat as possible. Now this hierarchy had existed even between the doctor and patient. There's a big power gradient. Right? This power gradient came as a barrier to communication, barrier to working together, barrier to caring. Can you care for another if you felt inferior or superior? You can only care for a fellow human being. You can't care for a god, or you can't care for somebody you think is not even human. That isn't why we became caregivers in the first place. So we must flatten this power game, and in a determined manner. This is one thing that will give a sense of worth to all the caregivers in whichever role they are playing. I include this in non-nursing assistants as well, right? In the caregiving of the patient. They must hold their heads high and play the role assigned to them wholeheartedly and with pride. What has happened is nurses are more and more involved with the clinical side of things. They are not just following orders. They're actively thinking about what they're doing. And when I was resident in the UK, I spent 5 years, and I could see that even in the early 80s, the ICU nurse was highly empowered. Right? She was better at me in cannulation, right? Better than me. I had to learn from a young nurse how to do the vas cath. And well, you have to keep your egos aside. When you're learning, you're just a student. So that is the way it is. The attitude of studentship must be kept alive, even after the residency, through the consultancy, through your leadership. That is what helps people discover themselves and help others discover themselves. This is what the relationship is. And that is how we combine. Now I see nurses also into research and academics. I mean, there are so many publications now, there are journals, And even as an editor of Indian Journal of Critical Care Medicine, I used to get submission from nursing groups. And I could see the energy in the new nurse of India. Okay? And I would swell a little with pride, as though it's my own daughter's doing this. Because that's the way to move. Away from the 1902 attitude. The two halves must come together. What are the two halves? See, the doctor, it is a flaw in the training, I agree, but they are always talking about curative approach. Okay? Cure. What is the... As soon as they see the patient, they start to write the prescription. Isn't it? Not all of us. A lot of us are doing that. Maybe for lack of time, but it's not really lack of time. It's also the way your attitude is developed. Okay? Your thinking procedure, your thinking monitor, your thinking treatment, your thinking surgery. Where is the caring? The caring side has been emphasized right since Florence Nightingale time in the nursing training. They never lose sight of that. Okay, the caring side is your strength. Caring side is your value. Caring side is what defines you. So it is not cure versus care, but cure and care coming together. This is what the two halves are, and the sum is more than the parts. So without this, your patient care isn't complete, right? And you don't derive patient satisfaction or family of the patient satisfaction. In this, we need to respect nursing autonomy. Why? Because most of the time it's the nurse beside the patient. You're not there, you're given your order and disappear. If she didn't have autonomy, he or she, only a conduit, there's no brain and heart functioning, only the hands are working. So that isn't what you are, that isn't what the patient needs, and that isn't what a right thinking doctor also needs from the nurse in the team. Now, disharmony is disastrous. Right? Most of the errors take place, medical errors, I think about 37-40% in certain statistics, because of miscommunication between the doctor and the nurse. Imagine. And some of it can lead to even mortality. You stress a nurse at the OT table and something gets left behind and leaves you in a disaster. So, it can be one extreme like that, but very commonly it is patient and family dissatisfaction. They see that there is no harmony, there is a chaos. They see inconsistency in what is being said and what is being done, and unfortunately you are going to not leave them satisfied. Many times when patient or family comes with a complaint, we tend to push the blame, the doctors tend to push the blame to the nurse. And unfortunately, the family picks the cue and they start to exaggerate all the mistakes. That is why the nurse must have a relationship directly with the patient and family. They should not look upon themselves as a conduit. You should have a direct relationship, and that's very, very important to both sides. Right? The nurse is not going to be what the doctor has projected for many selfish interests. But the nurse has her own rightful place in the eyes of the family and the patient. Autonomy, think yourself as a person, potential leader. You see many examples today. I saw wonderful nursing leaders. So, they're the living examples, and that's what we must aspire to be. Now, can we work together? course, it's great satisfaction to work together. Mutual respect is the basic beauty of relationship. There is no beauty, there is no creativity if there is no respect. So this, to my medical team, doctor team, I've tried to inculcate this most of my career, that you are not going to mistreat your nursing colleague. You are going to, even if there is a mistake detected, you're going to deal with it like a rational human person, to understand, develop your colleague. Okay, to develop your colleague, not to ascribe blame, not to put somebody down. That isn't anyway the policy of a quality team either. You don't name and shame. You counsel and develop. You give feedback and watch, right, how the changes take place. Acceptance. The doctors must accept that we have changed from this 1902 approaches, right? We have changed from there. We as a medical professional, as a caregiving professional, have evolved in our thinking, and we must respect autonomy. Now in the West, there is a lot more of changes taking place. You have the nurse practitioner who is empowered with certain level of decision making and also giving certain drugs as with an oncology nurse. And similar thing I started to see even in the ICU environment, that they are empowered to give certain drugs for symptom control, and they're also empowered to participate in complex decision making which involves both the science and art of medicine. What is the art of medicine? Science we all know, up to our teeth. Huh? So much technology, everything technology. We hype all the so-called goods of technology. But you can't take the human being away for whom the technology is developed. So the human side of things, and so important in this environment of high stress. There's a lot of anxiety, depression, post-traumatic stress disorder, grief reaction in the face of death. Now all this we are seeing on an everyday basis in our midst, and we don't know how to rationally, humanly deal with it, right? And you can't deal with it if you don't have the art of medicine, right? And this is how the two halves come together, and the nurse can give you great inputs as to what is the needs of the family, what are the needs of the patient. Nancy Malta was a nurse, intensive care nurse in the 1960s, who first wrote the inventory of family needs in a critical care environment. She listed about 10 of those needs. The first one was a need to have hope. The second one was a need to have information. Now, need to have hope. Now, who gives hope? And how is the hope given? It is given by caregivers. It is given by how you deal with them. What are the verbal, non-verbal ways of communication? What are the words you use? How sensitively you use, right? It's for both of us, doctors and nurses, to learn all this. Then there was another great nurse called Cicely Saunders, who started the hospice movement in the UK. She was originally a doctor. No, she was originally a nurse. Then she trained to be a doctor as well. So she combined both nursing and doctoring competencies. Cicely Saunders. Remember this name. You remember Florence Nightingale? Now these are the newer Florence Nightingales in the modern world. Now, so how to care for a terminally ill cancer patient? So she developed the first hospice in St. Christopher's in London, right? It's famous. Now it is a learning hub for palliative care. So that is how they learned. And there was an anesthetist called Kubler-Ross, Swedish-American, or maybe Swiss-American, who developed, again, what are the needs of a dying patient. Another list of things and how to deal with it. So, people who are in the caregiving profession, not necessarily doctors, develop these ideas. And therefore, they should be a part of the decision making. Particularly, you need to have the soft skills as well in the care of the patient. So it will be great to have workshops on these skills together. Doctors and nurses together, that's my dream. To have workshops on the soft skills, how to communicate, how to care give really. Okay? Technical things are there, but there's a huge dimension which left undeveloped will be left very partly developed. So the key to patient safety, somebody mentioned she's there all the time and she gives the first inputs. Okay, ever since I can remember right from my residency days, either through a note sent to you with a sentry or through a phone call, and nowadays through a message or whatever. It's the nurse who is telling you in the middle of the night, in the all odd hours, giving you the first clues of what is happening. If you shut her down or you don't give value to what she's saying, then you are just half a doctor. You are not developed properly. You should utilize these misgivings, these reservations, these questions. Then your patient is safe and your team is working and alive. Right? So, for patient safety, it is mandatory. A trusting relationship must develop. And you trust the nurse, even if it seems, sometimes a lot of big things start with the great small rumbles and you don't know for sure. And the nurse should feel trusted enough to tell you, doctor, something is not quite right. The heart rate has just gone up. It was 80 2 hours back and now it's 100. Hey, forget it, you give her crocin, But that is not the response. So if you have a trusting relationship, it comes with working together for a while. It comes with developing yourself as a professional constantly. This kind of catching early warning signs, conveying early warning signs, and the acceptance at the other end and action upon it saved lives. Is what saves lives. And that is why you can't afford to have attrition. You need to build together a relationship. Build together this trust and this action. So respecting each other's expertise is what mutual respect is. And one must love one's job. As a caregiver, that is what gives you the high. Okay, seemingly caregiver job is a thankless job. Not at all. In the caregiving, there is return automatically. Okay, in the caregiving itself. If you do it well, you just love your life and the role that you're playing. This is what we must allow to happen. The nurse to be able to love a job, the doctor to be able to love a job, and that is how they combine, and they combine with sincerity. Okay. See, I've been interested in end-of-life care for maybe 20 odd years. So you can have a happy family. This is a terminally ill cancer patient, Why is he so happy? All his children, grandchildren, everybody's there. That's what it is. It is having an ecosystem of caring, a liberal visiting hours. You're not running a jail, right? So this is possible with good communication, and this is the interface the doctor and the nurse has. Nurse most of the time by the bedside, giving attention, giving the proper cues and clues to the doctor, and the doctor trusting this value of the nurse beside the patient. So the candle can get extinguished, but it can get extinguished in tranquility, right? That is what caregiving means, and the quality of dying also. It's not just quality of life up to the point of death, and quality of dying as well. All that is important. So last bit, the way forward. Nurses, my sincere friendly advice, right? Please redefine your role as a nurse. Be aware of the goals of care, right? So don't be a conduit. Be an agent of caring. Understand what the goals of care for the patient are. Okay? Understand the whole medical side. Understand the softer side of how to care. Be well informed and take pride in your role. And there's every reason to take pride, because it's one of the noblest of professions and one of the most rewarding professions if you take it seriously. And to the doctor, stop your intimidating behavior and a regressive thought process which is as old as 1902. Put it in the dustbin, forget it, burn it, and be a new person, right? A new attitude for the physician. Draw out the shy and the timid nurse. Don't try to block her, right? She's very young. I mean, she's just out, 18 or 19 years old. So, and she's out of her home, long way sometimes. Draw her out, support, and you'll get the best out of her. Treat her as a colleague caregiver, which is what she is. Colleague caregiver, important cog in the wheel of caring. Allow her full expression as a carer. Okay, that's what gives her agency. Train both doctors and nurses in not only the technical side, but also in the human aspects of treatment. And that is how we combine, the two halves combine, curing and caring. Thank you. Is there any little time for questions, or is it over? Any moderator?
Thank you, Dr. Mani. First of all, what a fantastic vision you have. If our budding doctors, young doctors, the present generation will adopt even 10-20% of what you have put here, I think the life will be very different for our nursing team. They leave many a times. I mean, I know so many doctors who hold hands of nurses. They come forward, they train, they are true colleagues, and nurses move with them when those doctors move. On the other hand, I know of doctors who really are so difficult for the nursing team that although they wish to work in a particular department, only because of those overpowering doctors who forget these nurses are just starting their career. They have a long way to go, long way to learn. And many times I have examples of nurses who left nursing profession only because of some difficult doctors. So our request to people like you will be, please infuse some of your thoughts to more doctors who really handhold nurses as you have put across in your thoughts. And I'm sure you practice this every single day. Thank you so much for a fantastic presentation.
Thank you.
Thank you so much, sir, for such an informative session. Now inviting Anil sir to present a memento to our venerated Mani sir with a memento as an expression of our gratitude. So please welcome. Mani sir, please welcome. Yes. Let's now move on to our next speaker, known for her cutting-edge services in nursing, Ms. Josephine Cyril, Chief Nursing Officer in Sir Gangaram Hospital, New Delhi. Ma'am holds 34 years of experience, including 10 years of experience in Saudi Arabia. She has worked as Director of Nursing, Continental Hospital, Hyderabad, and Chief of Nursing, Artemis Hospital, Gurgaon. She is certified with Six Sigma Green Belt and ISO 27001. She is NABH Principal Assessor since December 2018. She is ANEI Executive Member and Chapter Head, Haryana, Infusion Nursing Society, Infuse Standard Assessor. She is a co-authored a chapter on infection prevention measures in emergency department for 2nd edition textbook of emergency medicine, including intensive care and trauma, published by JP Brothers Medical Publisher Private Limited 2022. Please welcome Ms. Josephine Cyril on stage. The topic is nursing and emerging strength of healthcare.
So good afternoon, everyone. So my topic is, I think, most of the things we covered in the discussions which we had till now, but still it is a very, very important topic in today's time because your theme is role of nurses in today's healthcare. So you can see here my topic. I want you all to look at my topic once before I begin. It's not moving. So nursing, nurses and our strength in the emerging healthcare, today's scenario, that is the topic. I haven't taken a quote from any nursing senior leaders. In the history there are plenty, generally I take. In this forum, since we are discussing about our role in modern healthcare, I want everyone sitting in this room, especially the young nurses, to think globally today. Our nurses are moving abroad. Every day we have people going to various countries, starting from Israel to Gulf countries to, I myself been in Gulf country for 12 years. So we are everywhere, every part of the world. Let's think globally today, what's our role and how we are emerging day by day as a most powerful force. If you look at this slide, of all the forms of inequality, injustice in healthcare, is the most shocking and inhuman. Means it is the inequality and injustice in healthcare. None other than Dr. Martin Luther King said. Dr. Martin Luther King, all of you know, he was such a fantastic leader who fought for the black Americans. And he, 1968, he was assassinated. He was very much for equal rights when it comes to anything, whether it is health or any kind of care to the citizen. But he was assassinated. You know the story. Same way, if you look at even in our own country, nurses are posted from the most interior towns to the most sophisticated, well-established hospitals like here. As nurse leaders, as young nurses, we have to think about how what are the things we are lacking to become more powerful, and what is the role we are playing today as a very strong workforce. Just remember, we are the largest workforce on earth when it comes to healthcare professionals. 60% of the healthcare professionals are nurses. Numbers matters. India, in every forum, our politicians, they always say, we are the largest democracy on earth. we have the highest population on earth because numbers matters. And we are such a powerful force, and our role and our strength was revealed during the pandemic, especially during the pandemic, COVID-19. I'm not going to talk much in detail, and you know it already. So, when it comes to definition of health, AHRQ, very, very strong organization, and we take their benchmarks as our quality parameters benchmarks. When we define health, we know the definition of health by WHO, and we know that just by caring the person physically, he is not going to be healthy. He has a mental aspect to it and a social aspect to it. Physical, mental, social well-being, the first part of the definition. So, AHRQ defines quality healthcare as doing the right thing for the right patient at the right time in the right way to achieve the best possible results. I am sure every nurse sitting in this room, whether you are a bedside nurse, whether you are a nurse educated, or whether you are a senior nursing person, all of us have only one thing in our mind: to do our best. That is the beauty of our profession. At times we do commit mistakes. All of us commit mistakes. We are human. Medical errors, plenty. When you look at JCA website, you can see how many errors are committed by medical professionals around the world. So it happens. So what we need to practice is understanding this definition in detail. And even medicine journal, nurses deliver high quality care by providing care that is safe, effective, person-centered, timely, efficient, and equitable. That is IOM journal definition. So even the doctors believe that it's a medical journal, and it says that we provide safe, effective, person-centered, timely, efficient, and equitable health care. So let's see this book. This is a beautiful book available on the net. I want the young nurses to read this. And I got so much of inspiration while reading this book online. And it gives everything about you all are the young generation, the future generation, future leaders, the future of nursing 2020 to 30, charting a path to achieve health equity, and how you can be the best nurses, best leaders, and how you can be a powerful workforce. So this is one of the most important slides which I got from WHO. You can see that I think I missed one slide before that. Let me just check on. Why is nursing workforce so important? Why it is so important that this workforce? During the pandemic time, governments around the world realized that 6 million more nurses are needed to ensure healthcare standards. To add on to the current strength, we need 6 million more nurses. To talk about the kind of healthcare, the equity in healthcare, the quality healthcare, the competent healthcare, whatever you call it to happen, we need more people. And the World Health Organization says the need is most acute in poor nations. Poor nations lack so much. There is so much to talk about it. And it is there that the care is not happening, where nurses could not shine. Because, during COVID, there were not even resources available. We know it. But, of course, we were blessed. We had still better off than many countries. Advanced economies also face shortages in the next decade. Why all the nurses are going abroad? Foreign countries, European countries who refused to take us when we applied during our time. Today they are in crisis. Their people are not taking up the profession. Senior nurses are retiring. And a huge gap. I have my own aunt, mom, sister, just retired from Australia, one of the reputed hospital. And she said the wards are lying empty. They are looking for Asian nurses, Filipino nurses to fill the gap. And one whole unit, only one nurse visible. Even if you apply as a nursing director, they are ready to take. Where are their policies, protocols gone? Earlier, they wanted so much regulations they had to take Indian nurses on board. Things are changing. Investment in training and strengthening nurse leadership is the key. We need good nurse leaders. We need powerful nurse leaders who understand the problems today, globally thinking. What are the challenges we are facing? If we are preparing our nurses with various mentorship program and other program and they are going abroad or within our country doing a good job, be happy about it. Because they are doing what is expected out of them, competent job. So nations' investment is important and nations must close the gap. We have a male brother here today as nurse leader, and even the last message, International WHO had released the Patient Safety Day message. Even in that they are telling, time is coming for male brothers to bridge the gap, the male-female nurse leaders. So be happy for the male brothers. And recently during my assessment days also, I have seen, past 1 year, I have seen at least 40% of the hospitals in Punjab belt, northern side, so many male brothers are working as DNS, ANS and nursing heads. So the gap is improving. So even they are becoming a powerful workforce. So this is the global scenario. And the beauty with us, we work interprofessional. We cannot work in isolation. We work with teams. So if a patient care support staff is collecting data on patient satisfaction, at the end, 99% of the patient satisfaction information is coming from the patients cared by us. So we interact with our clinicians, dietitians, physiotherapists. You look at the number of people we interact. So interprofessional connection. And this is what projected strength that nurses need to catch up by 2030 in region-wise and in income. So when you look at the region, Americas, they need to have more than almost 43% their workforce has to increase. Eastern Mediterranean 4, Africa 6, Europe 7, Southeast Asia 18, Western Pacific 22. So see the huge gap over there. They need workforce, nursing workforce of so much. And when it comes to income group, high income group 6%, low income 6%, low middle income 27%, and upper middle income 61%. So globally, there is so much demand for trained nurses. Now, we are very, very concerned about our competency. We had been hearing from morning about competency. And recently when I was interviewing a bunch of young nurses, at the time of interview, what they said when we asked few questions they could not answer. And they said, we are COVID nurses. It's a new term I learned. Very nicely, sincerely they told, like Sir has told in his presentation, the young nurses, young buds, handle them with a little more softness. So we asked clearly, what is COVID nurses? Frankly speaking, COVID nurses means they had not been to clinical area and they trained during COVID time. Only the books are being covered, the syllabus. Practically, they have seen nothing much. They have not been to an operation theatre, not a critical care unit, haven't taken care of patients. Imagine nurses getting a diploma and a degree qualification and calling us COVID nurses. So time is changing. The challenge before the nurse leaders are multiplying. It is multifold now. We need to train them. We need people. So we take such people on board and we have to train. So that is the workforce we are getting in front of us. So what qualities, what competencies we need to enhance in them, how to take care of our patients, and then how to coordinate. Coordination is our strength. The communication is one area we nurses need to still strengthen. It is a challenge. Our clinicians many times point out we do not communicate effectively. We need to, we have to. And patient education, we talk about patient education, we study a lot. But are we doing sincerely patient, disease-specific, individualized patient education? So that's the way we can become. I remember when I worked at Continental Hospitals, Hyderabad, the chairman over there, he has worked 30 years in America, US, and he has started this hospital. And he was the only clinician I have seen in my life who told me, every patient who is getting discharged will have a patient education written material from the nurse and handed over to him or her, based on simple nursing education coming. Suppose you are discharging a patient with a stomach or a diabetic patient, hypertensive, in your own words, what he should be following, or a bedridden patient. So that is something which patient education stands out, and public health intervention. Today we have to think about the public, the people with whom we interact. So a little bit more in detail of that I have put here. When it comes to care management, what we do, we are in the hospital, we take care of our patients. Enhance coordination of care, eliminate duplication of services. Very, very important. Things which are done by our colleagues, already done, we don't have to repeat it. There are other departments collecting patient feedback or something on which a checklist is done. Again, you don't have to repeat. So we have to find out more innovative ways of working, utilizing your time more efficiently, and increase patient engagement in self-care. Today's time, it is self-care. People are living alone, broken families, single families, children are working abroad. We need to educate our patients on self-care. So nurses, if we are telling we are the strongest workforce, we have to make our patients more participating in their own care while they are admitted in the hospital, or in their own care, self-management of their care when they are at home or wherever they are living. And number 2 is care coordination, which I explained, better coordination. And there are models available today, and that is transitional care. Transitional care is getting lot of momentum these days, where nurses are the best people to guide our patients how to manage their care at home. So transitional care, there is a beautiful book written by Dr. Mary Nile. She is a nurse theorist, and she had excellent teaching experience. She was a faculty also. And she has written so beautifully, when patients are getting discharged from hospital to home, how nurses can play a huge role, how they can, that shifting your care from hospital environment to home environment, because today patients are getting discharged much faster than what used to happen earlier. Today, shorter hospital stay, so the patients who are getting discharged are more in acute situation, so we need better care, and how we can handle it efficiently, we are the best people to train them. So another thing is to manage clinical and psychosocial and rehabilitative. There are people who are needing rehabilitative services, and we can guide them how to connect to in society. Rehabilitative services are available, how to get such services. So there is transitional care model available. If those who want to read further, there is transitional care model theory available on the net, and it's beautifully done by nurses. And this way we become more organized and systematic than just knowing about transitional care. You know exactly how to follow from the time when the clinician has taken a decision this patient is to be discharged, whether it is a palliative care, a hospice care, or a patient who is getting discharged after a surgery or after a medical condition. So this is another thing you can get. And the most important thing in transitional care is social care. And in social care also, nurses are doing wonderful job. You know, I have read an article on the site where a nurse just visits the patient who is all alone living and just spending time with the patient. He is just living all alone. He just visits. She just visits, and patient waits for her visit. And being there, talking about nothing, not only about disease condition, about what's happening around. I have shared this story with my team at STRH. I remember a story, a true story. In a dice like this, I heard a patient who was on ventilator and a young, middle-aged lady. And it was only the one nurse, one male brother who will come every day and take care of that patient and tell her all about that happened, outside, though she is on ventilator. He used to tell, he was off, he did like this, what's happening outside. Every day he used to share. Other people thought, this lady is on ventilator, so they did their routine care. And when she got extubated and discharged, there are no words. She wrote a book about him, about that particular nurse, and he was recognized by US President. Communication is that powerful, whether you are sedated, ventilated. Even when you are unconscious, your hearing is the last senses to disappear. So we are the best, we have to become the best communicators, especially when it comes to transitional care model. And we always have to think about person-centered care. Nurses today, if we are the strong workforce, because we are focusing that particular patient and his problems. That is what nursing process, when we put on paper, it is person-centered care model what we are writing down and what outcome we are expecting. See how beautiful it is if we think it in a positive manner. But that is where we need to strengthen, we need to train our young nurses. Patients know what they must do after all healthcare encounters to manage their health. They are the best people to tell us what they expect out of us. Now, the next generation of nurses, emerging strength, and the next generation of nurses all sitting out there, these are the things you need to encompass. Changing demographies. Things are changing. Today, the physical health and mental health is declining. People are falling sick. You just walk into a dialysis unit. We have a big dialysis unit, and I see youngsters are coming for dialysis. Working in, they are professional engineers, they are CEOs, they are coming from very good families, they are under stress, they have hypertension since long. The department is so busy, they are ending up with a renal failure, renal transplant. I'm giving one example, physical health. Youngsters 26, 28 undergoing PTCA, cardiac bypass surgery. Youngsters taking a bag full of medications when they get admitted, they carry along. We can't think about it past 10 years back or 20 years back. Mental health. 14% of the adolescents in the school are mentally disturbed. And today with all the technology and gadgets around, parents are too occupied, less time to spend with the children. We nurses have to think when we have such patients admitted with us. Morbid obesity. People have sedentary work style, work from home. We are the best people to educate them how to stay fit. So there is so much increased attention on racism and equity, I told, and adoption of new technologies, we heard, and changing patterns of healthcare delivery. Today, healthcare delivery, if you are unwell, you sit at home, log on to the net, see your doctor, and you get your problem solved. So time is changing, and the impact of COVID. So there is so much happening for the new generation nurses to think about and to overcome. So whenever you take care of patients, as a good nurse or as a good nurse leader, you have to think different level of human being. Person at a lower stream, midstream, upstream, we have to understand all that and practice equity in care to become a role model. So that's why I have written all that, so that we will practice. I'll go. I know the time is near. And preventive care is the need of the hour. Nurses can do an excellent job in implementing, in educating public, starting from school onwards, in participating in preventive care, acute care, chronic care. So that's what our role is everywhere. Aging population, life expectancy, it's increasing. It's good. But, when I visited few old patients, one of them commented, he has just 2 years to retire from a government job. He works with railways. He said, the saddest part in my life is loneliness. He lives all alone with his young son, who is always busy. He said, life is so boring, the loneliness is killing. So we understand that. So when you have older patients, be nice to them, talk to them, spend some extra minutes with them. So RNs can play a critical role in that. So primary health care, I want all the youngsters to understand, our role is not only in the hospital. We visit public health, our young nurses are posted over there. There are many nurses living for government job, primary health care. And so many clinics, even in Delhi, you can see in NCR region, so many clinics are coming up. So engage with the patients who have chronic problem. Nurses are doing that. And so much of teamwork happening there. So much we can contribute in the primary health care. And other than primary health care, nurses are a lifeline to care that meets them wherever they are. We reach to that individual wherever he is or she is. You remember During COVID, maybe post-COVID time, two young nurses, ANMs, they travel through the boat to reach to the other side of the river to give vaccination. Wherever it is required, nurses will reach, which any other health professional may not reach. That is the beauty of today's young nurses. See, and they were appreciated and their news came in the media. And at the same time, challenge in primary health care. A person carrying a full pregnant woman in the last trimester on a bicycle to bring him to the nearest hospital. Think the feelings of that couple. They are not the upstream couple, they are the lowest strata. Even then, we need to take care of them. So, home visiting and home care we already touched upon. And many times we have to practice advocacy that we are doing. We need to strengthen innovative home care program. That's what the need of the hour. The healthcare program always think in the house there are kids, children, adolescents, lot of issues. So it is not only the patient at home, you look at the social, the people over there in that house. So we also participate in their care. Now school health nurse, telehealth we have already discussed. Telehealth nurses are emerging as very strong people. We communicate to doctors from hospital or to patients through various telehealth devices, whether it is computer, mobile, all the applicants. And school, college education. Nurses are today working as CEOs, group heads, administrators, and we visit schools, we educate them, we identify their health issues. And today kids have so many issues in the school. We identify simple headache, stomachache, underlying reason may be an anxiety and depression, which we understand. So we have a huge role to play there. Cultural humility, we always look at every patient same, irrespective of the culture. India is such a vibrant country with different cultures, but for us, everyone is equal. So that's the beauty. High quality, equitable care we deliver, irrespective of their language barrier or culture. So COVID-19 has taught us a lot to be more human, to be more grounded, to be more humble, and life is so precious. Our own personal life we need to take care to balance so that we can deliver the best as a strong workforce. So children, I purposely put children because they are the future. When you come across pediatric group, we are there when the kid is born. We see the child development clinics, look at the parents, how worried and anxious they are. We meet them in the pediatric OPDs, in the wards. We have a huge role to play to guide the parents, starting from parenthood, planning pregnancy to antenatal and the postnatal care, and building up a child to an adulthood is a huge challenge. Nurses can play a huge role. So my last slides, remember we are short of 13 million nurses going to be by 2030. 13 million nurses. That is the WHO study. So it's not easy. So all of you sitting out here, young nurses, always think globally. Though you are locally placed, you make your workplace the best place. Learn the best. As Sir said, be a student always. But you think globally, what best you can do. When you do locally the best, it is affecting globally. So that is very, very important. Though it is for the nature, it is applicable for healthcare industry. So these are my last message to everyone. Begin at home, think globally, and act locally. Cultivate a world view. Not my place, my hospital, my unit. You have to think a world view and commit to learning. That is very, very important if you have to be a strong workforce. And SDH, Sustainable Development Goals, if you don't know, we should read and participate. Know where the regional international organizations are placed, what they are doing. As nurse leaders, if you can, get any help or any educational opportunity they are offering, get into it. It is good. Get involved in global health issues, which we are participating, and professional associations, be a part of professional associations. We young nurses, today's young nurses are very reluctant to join. Whatever we learned through various organizations, participating, conferences, workshop. When you're part of an organization, you learn a lot. So it is must. You must do if you want to do well. Be an advocate. You initiate things. If you have a new idea, you start it. Share it with other people and document neatly your policy, take ideas from other people, join others in ensuring your structure with others so that maybe something new happening elsewhere you learn it. There is no ego attached to it for any learning process. Ensure that nursing leaders and new nursing graduates know about policies. We make policies and keep it in a cabinet or on our desktop. It doesn't work. Policies have to be made discussing with them. Policies have to be shared with them. If you want your nursing has to be a very strong. Whatever we are doing is policy and process based. That's very important. And participate in research activities, nursing audits, hospital audits, various audits which are happening. And if you have something interesting, release it, publish it, share your ideas and achievements. And so, to conclude, I should say, we are a strong workforce globally at every level. From the, India, 70 to 80% of the population is in the village. From the primary healthcare center to the best, most advanced hospital in the industry, we are placed and we are doing, but we can still do more. Thank you.
Thank you so much, ma'am, for that insightful presentation and sharing your knowledge with us. Actually, we are waiting for someone special, so can you allow us to wait for only 2 or 3 minutes? हमारे पार्टिसिपेंट्स सब आप सब लोग को कैसा सेशन लग रहा है, कुछ गेन हो रहा है, कुछ कमियां, अच्छा सब कुछ बता सकते हैं. शेयर योर व्यूज, ओपिनियन. इट्स वेरी इंपॉर्टेंट फॉर अस एक्चुअली. बता कोई कहना चाहेगा? somebody is sitting at the back. No? Yes. Anybody wants to share anything? Yes, ma'am.
हाय माय नेम इज़ पूजा. मैं अपना एक्सपीरियंस शेयर करना चाहती हूँ. मैं हाइब्रिड वैस्कुलर कैथ लैब में एज ए नर्सिंग इंचार्ज हूँ. सम ऑफ आर पेशेंट्स गॉट सिक जब डॉक्टर्स प्रोसीजर्स करते हैं, लाइक मैकेनिकल थ्रोम्बोलाइसिस एंड ऑल. तो सडनली वी केप्ट ऑन हेड एंड साइड और हम देखते हैं वाइटल्स मॉनिटरिंग. व्हेन इट सडनली गोज़ डाउन और हम प्रॉम्प्टली एक्शन लेते हैं और बोलते हैं कि सर अभी ये बीपी ज़रा बहुत डाउन चला गया है, तो अभी हमें इसे लुक आफ्टर करना चाहिए. दे सडनली स्टॉप देयर प्रोसीजर एट दैट टाइम एंड मतलब हमें अपॉर्चुनिटी देते हैं कि हम उसको कर पाएँ, आगे अप कर पाएँ. तो जो डॉक्टर मैनी हैज़ सेड सम ऑफ द इम्पॉर्टेंट पॉइंट्स कि डॉक्टर्स को अपनी नर्सेस पे कॉन्फिडेंस होना चाहिए, ट्रस्ट होना चाहिए. दैट काइंड ऑफ कॉन्फिडेंस वी गॉट इन आवर डिपार्टमेंट. तो मैं कूडोज कहूँगी उन डॉक्टर्स को जो हमें अपॉर्चुनिटी देते हैं आगे जाने के लिए. सडनली वी फील सम काइंड ऑफ प्रॉब्लम्स विद यंग डॉक्टर्स. तो जैसे कि सर ने कहा, और फ्यूचर में हम
Thank you so much, ma'am, for sharing your experience. Now we have a very special personality with us. Introducing and inviting our leader, our mentor, our visionary, Mr. Yatharth Tyagi, Director, Yatharth Hospital and Trauma Care Service Limited. Dear delegate, participant, let's put your hands together for Mr. Yatharth Tyagi.
Good afternoon, everyone. Nice to meet you all. And I think post the session, if Mr. Sheenu can bring the dignitaries and the invitees to my office for coffee, I'll have a better chance to interact with them. Welcome all the nurses who have participated in this conference. I think it's a very good initiative from Sheenu as well as Anil to organize this. We regularly see a lot of CMEs at doctor level, but to have it at a nursing level, I think it really shows the seriousness and the commitment to improving nursing care at Yatharth as well as across all the hospitals. It's a forum where all the knowledges, values can be shared from special dignitaries who have done well already in this field and who are recognized at pan-India level. So that is very good to see, and good response also, good participation. I think just a few brief words about Yatharth Group. आप लोग को basic idea होगा ही. 4 hospitals हैं. This hospital where you're sitting is our latest hospital in Nord Extension. This is a 450-bedded hospital, and across PAN Group we currently have 1,400 beds. And recently Yatharth Group became a public listed company. So now we have from India more than 6 lakh people who are holding Yatharth's share. And so that is a commitment to not just the इंडिया के जितने भी शेल्डर्स हैं उनके लिए भी, और जो भी हमारे स्टाफ हैं, जितने भी डॉक्टर्स हैं, that we are committed to grow at a higher pace. So currently we are 1,400 beds, and the plan is in next 3 years we will be doubling our bed capacity and we will be a 3,000 bedded group. For that, every year for next 3 to 4 years we are opening up a new hospital. We have already identified some hospitals that we are going to acquire in NCR level, in Faridabad, Ghaziabad, Delhi, and also across Madhya Pradesh, because one of our hospital is in Jhansi Orcha also. So that is also a region. So going forward, lot of new hospitals and lot of new beds are expected in our group. At the same time, we are now looking at treatments that is trying to create a niche in super specialty treatments. So we are doing good numbers of bone marrow transplant. We are going to perform our first liver transplant on 28th of this month, and going forward also, these are some of the things that we're trying to create a niche and trying to make a mark. Especially this hospital that you are all present, we are trying to build it on the lines of super specialty, where all the renowned doctors are already part of us, and that is a very clear commitment that we have. Ultimately, it's the doctors, it's the nurses who build a hospital, who create a good brand reputation in the market. So not just at the doctor level, but at the nursing level also, we are very committed. And this is without doubt, it's just not the saying, but it's actually true that nursing is definitely the backbone. And at Yatharth Group, there's a very different personal one-to-one connection that we have with all the nurses. अब तो थोड़े hospitals ज़्यादा हो गए हैं, staff बढ़ गया है, but I would say until a year back or 2 years back, I, and along with all the board of directors, would probably know 90% names of each of our nurses working across our hospitals. So that is a special relationship we have shared with them. I remember in 2010 when we started the first hospital, we conducted camps in Himachal Pradesh and Punjab. A lot of nurses joined from there. Now a lot of nurses from South India are also joining. So I think a very special relationship we have maintained with all our nurses, have always considered them an extended part of the family, because doctors से तो interaction होता रहता है, but nursing जो कि एक backbone है, if, and I think that was also the topic today about the retention and the attrition high rates in the nurses pan industry. I think that is an important factor to address, and I do feel that yes, policies and creating culture like this does help, but it's also important at a senior level how one-to-one personal connections you form all these nurses. If they are made to feel that they're working as a part of an extended family, if they feel कि ये हमारा hospital है, तो वो nurses usually long term रहती हैं और वो अच्छा भी करती हैं. And this is what we are trying to create here. And I'm sure on the lines where Sheenu is progressing, and with the guidance of all the dignitaries who are present here, we will take a big step in this. And it's a very good also that we create a friendly environment at the industry standard also. So, yes, hospitals might compete with each other, but at one industry, if we are standing together, and it's also important to maintain that relationship with other hospitals, with staff of other hospitals. And if we do that, then I think we both parties benefit from the experience that we both share. So I think that's a good step in that direction. And I think going forward also, we'll continue to hold much more these conferences at our other hospitals also. And all the best to everyone. And I look forward to meeting you all in my office very soon. Thank you.
Thank you so much, sir, for such an inspirational address and sharing the vision of Yatharth Hospital. Ladies and gentlemen, we cannot speak and listen with empty stomach. Let's recharge ourselves with the lunch break. Please do join us for the lunch.
Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear, but there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe, listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality, to how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear, but there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe, listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality, to how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear, but there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality, to how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear, but there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality, to how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear, but there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality, to how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear, but there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe, listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word, it is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe, listen behind the factory noises of your panic. The birds are singing again, the sky is clearing, spring is coming. And we are always encompassed by love. Open the windows of your soul. Stay healthy and live the Yatharth way of life. Your health companion. Your Yatharth. Yatharth is not just one word. It is our assurance to patients. It is the passion of our doctors. It is what our team strives for in tiny details. It defines all our successes in the past. It is our inspiration to set new targets for the future. It is a commitment to invest in better infrastructure, technology and people. The Yatharth way of life. There is a hope that burns within our hearts, that gives us strength for every passing day. All over the world, people are looking at their neighbors in a new way. All over the world, people are waking up to a new reality. To how big we really are, to what really matters, to love. So we pray and we remember that, yes, there is fear. But there does not have to be hate. Yes, there is sickness, but there does not have to be disease of the soul. Yes, there is sickness, but there is always birth of newborns. Wake to the choices you make as to how to live now. Today, breathe. Listen behind the factory noises of your panic. The birds are singing again. The sky is clearing. Spring is coming. And we are always encouraged.
हाँ कौन करेगा वो कौन है Once again, welcome back. We hope you enjoyed your lunch and had a nice conversation with your friends and colleague. Now we have another eminent speaker, our guest, Captain Sandhya Shankar Pandey. Now I'm requesting Shinu Varghese ma'am, please welcome Captain Sandhya Shankar Pandey. Welcome on Das ma'am. Thank you, ma'am. Now, taking you forward in this journey of learning, please welcome Captain Sandhya Shankar Pandey, Corporate Chief of Nursing in Fortis Healthcare Limited. Ma'am has contributed 27 years to military nursing, industrial and corporate. She is associated with many institute and society like Maharashtra Nursing Council. She is Executive Member National Body and President Delhi of Association of Nurse Executive India. Life member of Nursing Research Society of India, Critical Care Nurse Society, Infusion Nurses Society, Association of Operating Room Nurses. She is a Governing Council member, President Delhi NCR Chapter of Infusion Nurses Society, India. Ma'am has been recognized with many awards like Super Woman Achiever Award at the World Women Congress, National Healthcare Women Leadership Award, Z News and CMO Asia, Max India Chairman's Award, Chief of Army Staff Commendation Card for contribution towards Bhuj, Gujarat Earthquake 2002, General Officer in Command Commendation Card, Operation Vijay Kargil War at 92 Base Hospital, Srinagar, General Karyappa's Medal for Best All-Round Outgoing Nursing Officer at AFMC. I would like to call upon Beauty with Brain to the dais and throw insight on this topic, measurable of nursing quality.
Can you just teach me on the, how do I, just slide change. This is slide change. Yeah. And how do I go back? How do I go back? The down one. Yes. No, I just need to see this. Can you just play this for me? What's your name? Yeah. So thank you, Neelam. I'm actually humbled. All right. A power-packed introduction and her energy which was flowing in after a great lunch. So do I blame the lunch or the energy of Neelam? I don't know. But more importantly, she has posed me in a difficult situation, in a challenging situation on keep up with her energy. And it's the most difficult task these people have given me, especially Shinu Madam and Neelam, to keep you engaged with a boring topic after lunch. Isn't it? You know, you make them work apart from away from patients. So probably, yes, quality can never be boring, and that's more important because we will see. So friends, please help me to do justice to the challenge which is being imposed upon me. Are you with me? Yes. Thank you for matching my energy. All right. Do you have a hand mic? Yes. All right, give it to me. Fine. इधर आके start कर. Okay, fine. Okay. It's not moving. इसको कैसे? अच्छा इससे करेंगे. हाँ, ये इधर से चल सकते हैं. ठीक, मेरे को खाली देखना है. All right. So friends, just जो आपके सामने. How many of you are more comfortable with a presentation in English? Okay. How many of you want the presentation or this discussion is going to be a discussion and interaction in Hindi? How many of you in Hindi? Both. That was my third option. Okay. How many of you are happy with
a combined interaction with both Hindi and English? Alright, so सबसे पहले जान लें आपके सामने कौन खड़ा है जो आपका अगला आधा घंटा लेने वाला है, या उससे ज़्यादा होगा तो आप सिग्नल दीजिएगा. Alright, so I'm Captain Sandhya and I come from Fortis Healthcare. It's a network of hospitals. Alright, and it's a network of hospital, and I take care of the nursing and support services vertical for the organization, and we have something called as power of care. Every nurse in the world will relate to it, but we have actually adopted this as our logo, and we believe in power of care. Okay? And with this, the gratitude from my organization and from myself comes to the nursing leadership and the unit leadership of Yatharth Hospitals. Can I have a big round of applause? Show that. Yes. Thank you. Anil sir and Shinu madam, you have really fed them well and a great lunch. All right, so thanks to you for the energy, and yes. Fine. So today we are going to actually have an idea about what's nursing quality measures. Quality hospitals and healthcare में 1980s से measure होने लगी है, जब लोग ये सोचने लगे कि हम जो काम कर रहे हैं इसका result क्या है, इसको monitor कैसे किया जाए. Okay, fine. Now I know where to stand. Thank you. Cool. Fine. So quality is certainly, when since 1980, when healthcare, in Indian healthcare, it started to shape and it started to evolve. But what happens to the nursing domain? Because 74% of Indian healthcare is delivered through private sector, right? So when 74% healthcare is from the private sector, you can very well imagine the largest population of hospitals. That's the nurses. Majority of the nurses are in the private sector, which does not have regulation. जहाँ पे नियम कानून अब ज़्यादा stringent हो रहे हैं, लेकिन 1980s में नहीं थे इतने. उस वक्त में, उस मुश्किल वक्त में नर्सिंग का रोल हॉस्पिटल्स में उसको शेप देना, उसको एक स्टैंडर्डाइज्ड वे में आगे लेके जाना, और गिविंग अ पोजीशन एंड पिचिंग इन हेल्थ केयर इंडस्ट्री has happened because of some standards, some regulations, and very immense hard work of some nurse leaders and also the nursing heads of the hospitals of Indian healthcare. While today I will be talking about quality in nursing, right? It's about nursing quality. My talk is also going to be a tribute to all the cons, the chief of nursings and the nurses of private sector of this country, who have indirectly and directly played a very important role in strengthening the healthcare in the country, where we stand today. Fine? And with this, I'm going to talk about a little bit. मैं ज़्यादा बोर नहीं करूँगी, but जब किसी का इतिहास, जब किसी चीज़ के बारे में जानना होता है तो उसका इतिहास ज़रूरी होता है. So a brief history, some definitions. थोड़ा सा ज्ञान होगा, ज़्यादा नहीं, but there will be about करंट नॉलेज, आज की तारीख में हम क्या कर रहे हैं, नर्सिंग फ्रेमवर्क में क्वालिटी का क्या रोल है, क्योंकि क्वालिटी डिपार्टमेंट, एजुकेटर, आईसीएन और हमारे सीएनओ मैडम पीछे पड़े रहते हैं कि आपने ये रिपोर्ट क्यों नहीं किया, इंसिडेंट फॉर्म क्यों नहीं भरा. इजंट इट? त्रासदी लगती है ना, है, सब सीरियल आ रहे हैं, देखो, है ना. बट लेकिन हम आगे देखते हैं इसका यूज़ क्या है. फाइन. नेशनल और इंटरनेशनल स्टैंडर्ड्स, एंड ऑफ कोर्स आज की तारीख में हमें इसे अपने हॉस्पिटल्स में रखना है कि नहीं रखना है. नहीं रखना है तो कोई बात नहीं, यू विल डिसाइड. और अगर रखना है तो क्यों रखना है. जब आप शाम को इस गेट के बाहर जाएंगे तो दिस क्लैरिटी शुड बी देयर इन द हेड. व्हाट एम आई सपोज टू बी? टू मेक माई सेल्फ अ वेल पोजिशन्ड, कॉन्फिडेंट नर्स टू प्रैक्टिस दिस प्रोफेशन. अंडरस्टूड? यू नीड टू गो आउट ऑफ दिस हॉल विद दिस क्लैरिटी इन योर हेड. Number one. And second, it's not about organizations, be it Apollo, Max, Fortis, Yatharth, Care Hospitals or Banjara or any other brand. It's about nurse, a professional nurse. do we really know how to behave and conduct myself as a professional nurse? That is what is the crux of this session. Because पहले हम बनते हैं, हमारी बुनियाद पड़ती है, बिल्डिंग खड़ी होती है, और बिल्डिंग खंडहर में कब बदलती है? एनी आइडिया, एनी थॉट्स? कोई भी खड़ी हुई इमारत खंडहर में कब बदलती है? जब वो प्रॉपर ध्यान नहीं देते. इस साइड से यूज़ नहीं हो रही है, ध्यान नहीं दे रहे हैं. यस, समवन रेज द हैंड. फाउंडेशन कमज़ोर हो रही है, लास्ट फ्यू रोज उसके बारे में नॉलेज नहीं है, या वो मेंटेन नहीं हो रही है, इजंट इट, सस्टेन नहीं हो रही है. तो ये सब चीज़ें क्या है? ये सब चीज़ें एक ही वर्ड है, उसको बोलते हैं क्वालिटी. ओके, सो इसलिए बिल्डिंग बहुत जल्दी खंडहर में बदल जाती है. दिस इज व्हाट इज क्वालिटी. एंड क्वालिटी इज अबाउट, सर्टेनली क्वालिटी एंड कॉस्ट गो सिनोनिमसली. हम हमेशा मैनेजमेंट को गाली नहीं दे सकते. सोच समझ के छोटी और बड़ी, अच्छी और बुरी, है ना, प्रोडक्टिव और कंस्ट्रक्टिव और डिस्ट्रक्टिव गाली वैसे देंगे फिर. Isn't it? Yeah, I'm also the management, so I keep facing the brand. All right, so don't worry. We will decide what to do. Fine, little bit of gyan on nursing quality. These slides are there with Shinu madam, and madam you can actually share with everybody. And quality indicators, which are the backbone. We call them backbone, but certainly we'll see how is it. But little bit of history, there are only 3 pointers in it. Way back in 1846, there is an Hungarian who actually found out that if we hand wash, there are going to be prevention in the hospital acquired infections in a healthcare facility. 19th century, followed by him, Florence Nightingale. Who doesn't know? Probably healthcare is synonymous to this name. Fine. And she used statistical methods. Means Florence Nightingale ने data use किया 1854 में, Crimean War के time पे, 1854 में Florence Nightingale knew how to use data, analyze and come back with evidences. That's the reason she was one of the most respected nurses of her times. She knew what to talk with evidence and logic, because facts gave her logics which nobody could deny. So आज की तारीख में अगर हम बोलते हैं कि data, so data probably is one of the weak areas in nursing which we all need to be aware of, rather than feeling bad, that how we have to strengthen this area with transparency to help my organization. And third one is Donabadian in 1966, and the most recent gentleman whom we also call the father of quality assurance. And he is the one who had actually further clarified how quality need to improve and shape up in the healthcare systems. Fine. Just इस diagram से कुछ समझ आ रहा है? This was actually created by Florence Nightingale to show in 1854 on morbidity किस तरह से, किस एरिया में बढ़ी है, किस एरिया में कम है, कैसे उसको यूज़ किया जाता है. Exact adaptation has actually white fonts which are faded in this area, but she had actually compared the mortality of soldiers in various areas from various countries. Apart from history, when we move, which are the bodies which are mainly responsible? I'm narrowing it down. Now, the umbrella of quality वो अब narrow होके आ रहा है nursing quality पे. हमारे लिए क्यों ज़रूरी है और क्या है ये? इंडिया में the apex body is called as Quality Council of India. And under Quality Council of India, there are two names, NABH and NABH Nursing Excellence. Okay? Your hospital is a proud awardee of both the accreditations, isn't it? Am I right? आपने किस respond ही नहीं किया? मुझे खुद पे doubt हो, हाँ मुझे खुद पे doubt हो गया, right? All right. And of course, this is your futuristic journey where you are aspiring for the golden seal. So all the best and God bless you for achieving on this quality journey. Now, these are few definitions. When we say quality in healthcare, quality measures और indicators क्या होते हैं, और benchmark. आपने दो नाम बहुत commonly सुने होंगे, quality और quality indicators, isn't it? Nursing quality indicators. But सबसे important है इसमें benchmark. Benchmark क्या होता है? We'll see it in the subsequent slides. But nursing quality indicators, these are all basic definitions and some ज्ञान. इसके बाद ज्ञान नहीं होगा. So I'll just request to bear with me for some time. And all right. So nursing quality indicators are standardized evidence-based measure of quality of nursing care that is readily available as hospital inpatient administrative data. And purpose we have already mentioned here. This can be referred. But सबसे important है ये ज्ञान, इस हॉल में बैठे हुए हर प्रोफेशनल के दिमाग में आएगा कि मुझे क्यों पढ़ाया जा रहा है बैठा के, isn't it? Because बच्चे होते हैं, बच्चे उनको वो पढ़ाते हैं तो they actually adopt. But it's the most important principle of adult learning. Hope everybody is above 18 years here. फिर भी कोई नहीं बोल रहा है, शीनू मैडम कोई नहीं बोल रहा है. Are all of you above 18 years? Thank you. All right, fine. मैडम को लग रहा है डाउट है. All right, so if it's one of the most important adult principles, adult learning principles. उनसे कोई ज़बरदस्ती नहीं करा सकता, right? वो अपनी, they have their own choices, their own judgments, and that's the reason if one has to work with them towards success, partner with them, isn't it? So that's the reason the adults, the seniors, like all of you, need to know what is there for you. Every person thinks what's there for me. Then only they will be engaged in it to learn. And this is very important learning session, all right? But benefits. These are some very important points. As nurses, we all know, we are aware about it. हमें पता सब कुछ है. लेकिन जब स्ट्रक्चर्ड वे में उसको लिस्ट करके अपने दिमाग में क्लैरिटी लाने की ज़रूरत होती है, उस वक्त प्रोबेबली ये स्लाइड ज़रूर काम आएगी कि हमें ये नर्सिंग क्वालिटी की ज़रूरत क्यों है. उसको मेजर करने से पहले हमें ये तो पता चले कि ये हमें हमारे लिए हमें चाहिए क्यों, isn't it? और उसके लिए ज़रूरी है, it improves my patient outcomes. It improves my patient outcomes because we'll see. And second is enhanced patient safety. Now patient outcome patient safety से होता है. मेरे पेशेंट को अगर मैं एक कैनुला लगा रही हूँ और कैनुला अगर मैंने एक प्रिक में अचीव कर लिया है, उसमें सही डाइल्यूशन में मैं मेडिकेशन एडमिनिस्टर कर रही हूँ, my patient medication administration will be safe, the vein will remain intact, outcome of a venous access will be great, and patient experience due to this impending pain or infection will be great, and that's how patient safety will be there. Patient experience will be wow, or patient experience will be good, fine, but clinical outcomes related to impending pain, impending inflammation, impending infection will be saved. Right? And that is called as good clinical outcomes. ये थोड़ा सा जटिल है, अभी जब मैं बोल रही हूँ शायद ग्रीक एंड लैटिन लगे भी कई लोगों को, लेकिन हम आगे जैसे बढ़ते जाएंगे थोड़ा सा आपको शायद समझ आता जाएगा. लेकिन by virtue of your NABH and NABH nursing excellence, probably these terminologies will be not new for you. Enhance optimized resource allocation, increase patient satisfaction, and most important is efficiency and cost effectiveness. मैं एक एग्जाम्पल पूरे सेशंस में लेती हुई चलूँगी. जैसे अभी हमने कैनुलेशन की बात की, बड़े बड़े HAIs की बात नहीं कर रहे हैं, कैनुलेशन, क्योंकि ये एक प्रोसीजर है जो हम अपने पूरे सेशन में बात करेंगे ताकि हर एक चीज़ इसी पे आके रुकेगी. कॉस्ट इफेक्टिवनेस, क्योंकि अगर मैं प्रिवेंट करती हूँ कि उसमें इन्फ्लेमेशन ना हो, डाइल्यूशन ठीक हो, तो ऑटोमेटिकली पेशेंट को 2 से 3 से 4 कैनुलास नहीं लगाने पड़ेंगे, राइट? कॉस्ट अपने आप ही पेशेंट के लिए इट इज़ बेटर ऑन द पेशेंट्स पॉकेट. ऑप्टिमाइज रिसोर्स एलोकेशन, जिस पे मैं चुप रह गई थी कि it allows actually the staffing levels. Fine. Quality हमें help करती है कि हम अपने patients को कैसे staff allocate कर सकते हैं और कैसे हम उनसे उनके लायक competency के लायक काम हम उनको दे सकते हैं, काम assign कर सकते हैं. कैसे? We will see this. There are some more benefits like professional development, regulatory compliance and accreditation, risk management, transparency and accountability, benchmarking and best practices. ये जो हमने 11, 12 and next slide is very powerful. This is the nurses' satisfaction. Because the studies have actually proven, ये 2 साल तक almost 30,000 nurses were monitored in 2 countries, that is US and UK, by International Nurses Association, and it was found that by having a strong nursing quality framework in the hospitals, quality of care increased by 20%, intent to stay with the organization, that like उनके attrition कम हो गए by 29%, nurses employment, nurses जो इस profession को चुनना चाहते थे, increased by 25%, infection rate hospital का reduced by 87%, fall related injuries, sentinel and non-sentinel routine, reduced by 17%, and pressure ulcer rates decreased by 59%. And it was something really whopping. There are references where all of you can, those who are interested, can actually further go and read how did these hospitals arrive and reached at this conclusion, right? Because this is something very, हम हवा में बात नहीं कर रहे, हम ये बात कर रहे हैं एक एविडेंस के साथ कि नर्सिंग क्वालिटी की वैल्यू और इसकी ज़रूरत क्या है. आई एम टेकिंग अ 1 minute pause. You know, friends, there are more than 200 countries in this world. There are 130 countries in this world who are the members of International Council of Nurses, right? This means 130 countries have their nursing councils and nursing boards, right? Out of these 130 countries, there are only 25 countries, those who have some regulatory bodies to control, regulate and have a governance system for nursing. 25 countries. Out of these 25 countries, there are only 11 countries today in the world, those who have standardized accreditation for nursing excellence. And India is one among them. You know that. This is the weightage and this is the need. You know how come it has come? It has come because of the nurses of India, those who have actually adopted, the hospital managements, the hospital leaderships, those who have valued the nursing standards, nursing quality. It has come through those hospitals who think, and of course Quality Council of India, those who think कि अगर health care को strengthen करना है तो हमें nursing quality को support करके उसको अपनी spine बनाना पड़ेगा. उस spine पर ही health care framework खड़ा होगा qualitatively, right? India is one among those absolute 11 countries in the world. Fine. And with this context and its weightage, I'm drawing your attention back here कि quality, जिन nurses को quality समझ आती है, जो quality practice करते हैं, उन hospitals का result मैंने आपको दिखाया because वो अब तक की world की nursing की सबसे बड़ी study है, nurses satisfaction पे. And next इसके बाद आता है कि हम nursing quality को हम कैसे बांट सकते हैं आगे, क्योंकि nursing quality की जब हम बात करेंगे ना, तो patient admission से लेकर उसको bed में receive करने से लेकर investigation, surgery, operation, medication से लेकर discharge में उसके घर तक, उसकी गाड़ी तक बैठाने तक, हर जगह nursing quality आता है, isn't it? कि नर्स ने ठीक से बात की, नर्स ने पेशेंट को हैंडल किया, स्ट्रेचर से बेड पे रिसीव किया, कैनुला लगाते वक्त हाथ ठीक से पकड़ा या नहीं पकड़ा, या फिर मेडिकेशन हमने हाथ में उठा के दे दी या एक मेडिकेशन कप में दी, या हमने डॉक्टर को हमने सेंट्रल लाइन डालते वक्त हमने ग्लव्स ऐसे खोलकर हाथ से निकाल के स्टेराइल ग्लव्स दिए, या हमने पाउच खोलकर हमने आगे बढ़ाया? Isn't it? It's about everything. तो हम क्या क्या गिनेंगे और क्या क्या मेजर करेंगे? पॉसिबल नहीं है. There will be thousands of activities, isn't it? बट इसमें से ये सारी नर्सिंग एक्टिविटीज़, नर्सिंग एक्शंस में ऐसा क्या है जो हम कॉन्क्रीट वे में रख सकते हैं, जिससे एक तीर से 10 निशाने लग जाएं, है ना? और एक पैरामीटर से मेरे 12 पैरामीटर मेजर हो जाएं और उन पर इम्पैक्ट हो कि वो इम्प्रूव करें. Isn't it? That's why it is called as what is, this is a little bit theoretical slide, but the next ones, yes, there are safety, effectiveness and experience where we measure our quality outcomes. Those who are interested, please read the slides. It has got notes also, so you can actually acknowledge yourself and have some more insights. But सारे नर्सिंग के वर्क्स को अगर हम 3 चीज़ों में बांटते हैं, हम जितनी भी नर्सिंग प्रैक्टिस करते हैं हॉस्पिटल्स में, इफ़ वी डिवाइड इनटू दीज 3 थिंग्स, स्ट्रक्चर, प्रोसेस एंड आउटकम्स, तो हमारी पूरे नर्सिंग अम्ब्रेला को हम इसमें समेट सकते हैं. पहली चीज़, स्ट्रक्चर में क्या क्या आता है? द कैपेसिटी ऑफ द प्रोवाइडर्स टू रिस्पॉन्ड टू द पेशेंट नीड. प्रोसेस में एक्टिविटीज परफॉर्म्ड विद एक्टिविटीज परफॉर्म्ड. एंड थर्ड वन इज आउटकम, मीन्स what is the result at the end of providing care or concluding an activity. Fine. Now this is the most important, I would say, protoplasm of this entire session. This slide tells you common ones as on today in Indian scenario. What could be the possible structural indicators? हम अपने hospitals में ये सब measure करते हैं, और this we have actually laid for 4 years, and after 4 years I'm proudly I'm in a very satisfied state to share that we have arrived at success on these things by winning a lot of accolades also for nursing. But structural indicators में nursing से related क्या क्या parameters हो सकते हैं जो as an in charge administrator हम measure कर सकते हैं. Process indicator में as an quality nurse, एज एन इंचार्ज, एज एन एडमिनिस्ट्रेटर हम मेजर करते हैं. और आउटकम इंडिकेटर्स में हम क्या मेजर करते हैं? दीज आर ये एक स्लाइड वो अम्ब्रेला है जिसके अंडर में हम नर्सिंग की सारी एक्टिविटीज़ को इकट्ठे समेट कर उनको मेजरिंग सिस्टम में डाल सकते हैं. राइट? यू वॉन्ट मी टू स्विच ओवर टू इंग्लिश और दिस इज़ ओके? ओके. अच्छा, एक चीज़ और, मेरे को पता है आप सब मंत्रमुग्ध हैं, नहीं ना? ओके, तो प्लीज़ बीच में भी हाथ खड़ा करके आप प्रश्न पूछ सकते हैं. ऑलराइट, फाइन. ओके, ये एक छोटी सी आई वुड से ये स्लाइड और नेक्स्ट स्लाइड एक टूल है आप सबके लिए कि हम एक प्रोसेस को इफेक्टिवली कैसे इम्प्लीमेंट कर सकते हैं. जैसे पिछली स्लाइड में देखा कि हमें करना क्या है, हमें प्लान कैसे करना है. तो ये है जैसे नंबर ऑफ नर्सेज, नर्स पेशेंट रेशियोज़ इन ICUs एंड इन वार्ड्स, नर्स के हमारे क्वालिफिकेशन लेवल्स क्या हैं, क्रेडेंशियल, दैट इज़ क्रेडेंशियल्स, राइट. हमारे नर्सेस, हमारे पेशेंट टर्नओवर क्या है, हमारा नर्सेस टर्नओवर क्या है, और न्यू नर्सेस टर्नओवर क्या है. न्यू नर्सेस यानी कि साल भर के अंदर भी जो नर्सेस हमें छोड़ के चले जाते हैं. और स्किल मिक्स और केस मिक्स हमारे पास में किस तरह के नर्सेस हमारे डिप्लॉयमेंट में, और उसके इनके बेसिस पे वी कैन डिज़ाइन वेरी गुड स्मार्ट रोस्टर्स, right, across the hospital. And we are ready to share in case required, because these are all auto-populated tools we've developed. And monitoring care, process, इन तीनों में भी अगर किसी को चूज़ करना हो जिससे पेशेंट सेफ और डिलाइटेड रहे, तो ये है सेंटर वाला और बीच वाला सेक्शन जिसको हम प्रोसेस बोलते हैं. राइट? जिनको नींद आ रही है, जो जमाई ले रहे हैं और जो बोर हो रहे हैं, प्लीज़ उठ के पानी पीजिए और अपने आस पास, बिकॉज यू नो यॉर्निंग इज कंटेजियस, दे से, isn't it? And the easiest one to combat this is stop yourself, disconnect from the screen, take 5 deep breaths. Take 5 deep breaths, you will stop your yawning and you will be back with me in the session. Understood? कितने लोगों ने ये सुना? Wow, yaar, I am impressed. Lovely nurses you have, sir, and Shinu ma'am. Wonderful. Okay. So ये जो बीच वाला सेक्शन है इसको प्रोसेसेस बोलते हैं. सबसे इंपॉर्टेंट है, क्या नर्सेस को हमें मालूम है कि प्रोसेस बोलते किसको हैं? प्रोसेस इज एक्चुअली अ सीरीज ऑफ एक्शंस टू फॉर एन कॉमन गोल. वन एग्जाम्पल, क्या कोई एग्जाम्पल देना चाहेगा यहाँ पे प्रोसेस का? कोई भी एक प्रोसेस का एग्जाम्पल, एनीबडी? ये वर्ड नर्सेस को बहुत डराता है, नर्सेस ज़्यादा समझते नहीं है, वैल्यू नहीं देते हैं, लेकिन नर्सिंग में सबसे ज़्यादा वैल्यू ही इसी वर्ड की है, प्रोसेस. नर्सिंग केयर प्लान इज अ प्रोसेस. वंडरफुल. हाउ? इसमें मल्टीपल एक्टिविटीज़ क्या है? Income input to the output. Wonderful, superb. Another process where nurse is very much involved, say patient transfer. Patient transfer, doctor is writing where the patient has to go, another doctor is assessing, then nurse is doing her assessment, preparing the document, preparing the medication return or HIS transfer, documents, preparing the patient, shifting on the bed, moving. इन सबको ब्रेक डाउन करें तो देयर आर नियरली 43 स्टेप्स इन पेशेंट ट्रांसफ़र. ये एक प्रोसेस है, बट इनमें से अगर एक भी स्टेप मिस हो गया तो क्या होगा? राइट? पेशेंट इम्पैक्ट होगा, या तो एम्प्लॉई एज ए नर्सेस केयर गिवर्स पे असर पड़ेगा या पेशेंट पे असर पड़ेगा, लेकिन आउटकम और क्वालिटी और सेटिस्फैक्शन तीनों कॉम्प्रोमाइज हो जाएंगे. Isn't it? This is what a process, because and these are common nursing processes. Fine. Now these processes, one say 8 ones which you see in the bullet in italics here, these are the 8 processes which actually directly 8 and indirectly impact nearly 56 sub processes in the nursing care journey. Right? So अगर हम ये 8 को ठीक से करते हैं तो मेरे 56 टच पॉइंट्स जो पेशेंट के होते हैं ना, वो एड्रेस हो जाते हैं डायरेक्टली और इनडायरेक्टली. आपको ये मैजिक समझने की ज़रूरत है कि आप जैसे कहते हैं ना, एक तीर से 10 निशाने, एक तीर से 12 निशाने, ये 8 से 56 निशाने. राइट? दिस इज़ वॉट वी नीड टू अंडरस्टैंड. मैं खाली एक एग्जाम्पल दूंगी, ओनली वन एग्जाम्पल. एंड अगर हम बोल रहे हैं compliance to IPD fall prevention process. Now fall prevention process, this is one of the commonest example because this imposes a serious medico-legal threat on nurses also. जब पेशेंट मेरे पास न्यू एडमिशन आया है, उसका इनिशियल असेसमेंट करना है. कितने लोग इनिशियल असेसमेंट करते हैं? सब करते हैं, हम सब करते हैं. ऑल राइट. और सबके पास एक टाइम भी होगा, अरे आधे घंटे के अंदर करना है, 1 घंटे के अंदर करना है. इजंट इट? टाइम लिखो पहले, है ना? क्वालिटी विल कम एंड चेक द टाइम. सबके ऊपर प्रेशर है ये, मेरे ऊपर भी रहता है. ऑल राइट. सो जब हम इनिशियल असेसमेंट पेशेंट का कर रहे हैं तो हम में से कितने लोग हैं वो ऑनेस्टली पेशेंट की ठीक से हिस्ट्री लेके उसका स्कोर कैलकुलेट करके उसका स्कोर लिखते हैं? नंबर 1. उसके 3 एक्शन और हैं, 1 मिनट. हम उसका स्कोर कैलकुलेट करके लिखते हैं और स्कोर के साथ फिर हम ये आइडेंटिफाई करते हैं कि पेशेंट की रिस्क कैटेगरी क्या है, माइल्ड, मॉडरेट, सिवियर. माइल्ड, मॉडरेट, सिवियर के साथ में हम उसका लिखते हैं कि इसके लायक नर्सिंग इंटरवेंशन क्या है. राइट? हमने अगर ये प्रोसेस यहाँ पे ठीक से की है तो ये मेरे पेशेंट का बहुत अच्छा रिस्क असेसमेंट होता है. आने वाली शिफ्ट्स कॉपी पेस्ट ना करके अगर वो सही से इसी तरह से अपनी आदत डालते हैं, हर नर्स अगर अपनी आदत इस तरह से डालती है, वो नर्स के लिए पर्सनल बेनिफिट तो है ही, क्योंकि वो फॉल रिस्क असेसमेंट में जो ग्लोबली एक वन ऑफ द मोस्ट इंपॉर्टेंट IPSG है पूरी दुनिया के हेल्थ केयर के लिए, बट वो नर्स उसमें एक्सपर्ट हो जाती है. राइट? उसके केयर प्लान को कोई चैलेंज नहीं कर सकता है, बट एज एन इंचार्ज, एज एन एडमिनिस्ट्रेटर हमें सबको ये सिखाना पड़ता है, क्योंकि आदत डालना जो हमारी फ्रेशर नर्सेज आती हैं वहाँ से शुरू होती है, जब हमारी बुनियाद पढ़नी शुरू होती है. राइट? सो ये एक है जब हमारी प्रोसेस, दिस फॉल प्रिवेंशन प्रोसेस इनडायरेक्टली टचेस 12 सब प्रोसेसेस. 12 सब प्रोसेसेस. ओके? सो ये एक बहुत बड़ा इवेंट है या आइटम है, आई वुड से, एंड दिस इज़ व्हाट वी नीड टू अंडरस्टैंड. सो इसलिए इन प्रोसेसेस को समझना और उनको ठीक से करना नर्स की इंडिविजुअल सफलता में बहुत क्रिटिकल होता है. और ये नर्सेज अगर इसको समझ जाएं कि क्या करना है, वो एनक्लेक्स आराम से लिख सकते हैं. वो अपने OET आराम से लिख सकते हैं, बिलीव मी। वो अपने सारे कॉम्पिटेंसी ऑस्की जो है वो आराम से क्लियर कर सकते हैं इफ़ दे अंडरस्टैंड दीज इंडिकेटर्स, बिकॉज वो सारे इन्हीं प्रिंसिपल्स पे बेस्ड हैं। एंड थर्ड वन आई सेड वॉज आउटकम, एंड हियर इट गोज एज इम्प्लीमेंट कैसे करना है। दिस इज मोर फॉर अंडरस्टैंडिंग ऑफ द इंचार्जेस एंड दिस टीम लीडर्स एंड द एडमिनिस्ट्रेटर्स कि हम एक सही मायने में प्रोसेस को इम्प्लीमेंट कैसे कर सकते हैं, और इन केस अगर कुछ हो जाए तो हम कैसे उनका रूट कॉज एनालिसिस करें। और रूट कॉज एनालिसिस के लिए प्रोबेबली मैंने भी अपनी कलीग से पास्ट में सीखा था जब मैं दिल्ली नई आई थी, और आई कुड नॉट हैव लर्न बेटर फ्रॉम एनीबडी एल्स बट Shinu, because she's a master of root cause analysis. The whole organization used to be very proud of her, right? So, and hope your nurses are actually benefiting from that. But most important, look at the last line, because it works immensely on the nurses, enhancing nurses' clinical quotient and empowers them to express without fear while at the bedside or in the boardrooms themselves. Because जिस nurse के पास information है, जिस नर्स के पास में डेटा रिलेटेड इन्फॉर्मेशन है अपने पेशेंट्स के लिए, उसके पास लॉजिक है, एंड दिस गिव्स हर कॉन्फिडेंस, एंड ही और शी कैन एक्चुअली वाउच एंड पुट अक्रॉस देयर पॉइंट्स विदाउट फियर, बिकॉज दे नो दैट दे आर स्पीकिंग द ट्रूथ, राइट? एंड दिस इज़ वॉट इज़ कॉल्ड, ये तो हो गई अच्छी बातें जो हमने की कि हमें क्या फ़ायदे हैं और हमें कैसे करना चाहिए। लेकिन असलियत में बहुत सारे चैलेंजेस भी होते हैं। देयर आर लॉट ऑफ चैलेंजेस. We say structural challenges, organizational politics, cultural challenges in the hospital, level of knowledge of my superior, emotionally those who are reactive or those who are responsive. कहते हैं ना, एक इंसिडेंट में या तो कोई रिएक्ट करता है तो नीचे टीम पूरी डर जाती है, या कोई रेस्पॉन्ड करता है. देयर इज अ 2 words. एक पेशेंट फॉल हुआ है और एज एन इंचार्ज मैं बोल रही हूँ क्या हो गया, क्यों गिर गया पेशेंट, कैसे गिर गया, अभी क्या होगा, अभी क्वालिटी आएगी, अभी सब कुछ होगा, एंड आई एम गोइंग टू बी सैक्ड, फाइन, बिकॉज देयर इज एन हेड इंजरी. और इसका दूसरा है, पेशेंट गिर गया है, प्लीज़ जरा सबसे पहले पेशेंट को संभालो, 2 लोगों को और हेल्प के लिए बुलाओ, और उसके बाद देखो कि इसका रिस्क असेसमेंट के हिसाब से क्या, ये अगर ये सीरियस कैटेगरी था तो हमने कुछ किया या हमसे कमी रह गई थी. 2 तरीके होते हैं. इसको बोलते हैं रिएक्टिंग वर्सेस रेस्पॉन्डिंग. एडल्ट्स, अगेन एडल्ट्स चूज व्हाट डू यू वांट टू बिकम, रिएक्टिंग और रेस्पॉन्डिंग. Those who are responding will go to the the last line of the previous slide. They are nurses with very, very high level of EQ and CQ, emotional quotient and clinical quotient. क्योंकि ये सब कुछ भी हेरिडिटरी नहीं है फ्रेंड्स, कुछ भी हेरिडिटरी नहीं है, कुछ भी कंजेनाइटल नहीं है, कुछ नथिंग इज कमिंग ओवर जनरेशंस. ये सब एक्वायर्ड है जो हम जिंदगी की किसी भी स्टेज में एक्वायर कर सकते हैं. Right? So choice is up to us what we want to be. And psychological and technological challenges, as well as, overarching the culture in the organization for which we are equally responsible. And next is just enumerated challenges for the nurses, which they encounter while practicing nursing quality in the hospital. Sorry, my mic is moving away from my this thing. Objectivity of patient outcomes when it is not clear and multiple teams are handling and they do not arrive at a consensus, they impose a challenge for nurses. Nursing care which is multidisciplinary and multifaceted, teams which are not in harmony with each other, but the nurses are the ultimate one who face the brunt of it. Variability in the nursing practice, where temperature अगर record करना है तो कोई टेम्परेचर को माउथ में रखता है, कोई इंक्लाइंड रखता है, कोई ज़बान के नीचे रखता है, तो कोई खाली ओरल कैविटी में रख देता है, राइट? कोई 30 सेकेंड्स के लिए रखता है, कोई 60 मिनट्स के लिए रखता है, कोई 1.5 मिनट के लिए रखता है. बट इट्स ऑल अबाउट द स्किल, कॉम्पिटेंसी एंड द प्रैक्टिस विच दे हैव एक्वायर्ड. फाइन, बट standardization and evidence as well as scientific approach is something very important. And dynamic healthcare environment, data collection and documentation issues where there are too many. अगर हॉस्पिटल को ये नहीं पता है कि मुझे कौन सा डेटा कैसे और किस तरह से और कितनी मात्रा में कलेक्ट करना है, एम्प्लॉयज़ सफ़र करते हैं, सारे एम्प्लॉयज़ एंड मेजॉरिटी नर्सेस. They are the biggest data providers, right? So clarity at the top is very important on without causing any duplication of information on data collection, resource limitation, patient satisfaction, and clinical outcomes. This always impose a pressure and matrices with nursing values and incorporating preventive care. But this is something, ये 2 slides का जो jargon है, ये इन 5 points में हमने conclude करने की कोशिश की है कि registered nurses in the hospital, they are challenged with lack of time. Lot of time, lack of awareness on the matter, on the topic, on the drug, on the case, on the process or on the equipment. Available level of nurses staffing, lack of understanding on how to use these instruments, and inadequate number of nurses, that is shortage, right? Last phase of this session, this is not enough. अब तक आपने सबने इतना काम किया हुआ है, किया है, डेटा मेजर किया है, प्रोसेस मेजर किया है, पेशेंट का काम किया है, पेशेंट को डिलाइट वाओ सब कुछ. बट देर इज समथिंग मोर इम्पॉर्टेंट. हमने शुरुआत में बात की थी बिल्डिंग की, इजंट इट, मेंटेनेंस. अगर हमने उसको वाइट वॉश करके, उसके रिपेयर वर्क्स करके उसको मेंटेन नहीं रखा है तो बिल्डिंग खंडहर बनती है जल्दी. तो जब हम उसको वाइट वॉश करके फिर हम उसका राउंड लेते रहते हैं, देखते हैं सीलन कहाँ आ रही है या उसके जॉइंट्स कहाँ कमज़ोर पड़ रहे हैं, जहाँ कहाँ पे रिपेयर की ज़रूरत है, इजंट इट. या बिल्डिंग को हर 3 साल में या हर 5 साल में एक वाइट वॉश की ज़रूरत है, हर 5 साल में वाइट वॉश की ज़रूरत है. सिमिलरली देयर इज़ अ वर्ड कॉल्ड एज बेंचमार्क, राइट? कि ये एक लेवल है, इसके ऊपर अगर हम गए तो मेरी केयर में कुछ प्रॉब्लम है, मेरे पेशेंट को खतरा है, या एज अ नर्स मुझे सम लीगल इम्पोजिशन और लीगल थ्रेट इम्पेंड हो सकता है. फाइन. And that's the reason this is a definition, because this is something very important aspect I would say, understanding of benchmarks. हर nurse को ये पता होना चाहिए. ये this has got recently included in our final BSc nursing curriculum also, which was rolled out 2 years back in India after 75 years, where quality has a dedicated chapter and there is a lot on benchmarks. सो नर्सिंग स्टूडेंट लेवल से बेंचमार्क की अंडरस्टैंडिंग सबके लिए बहुत ज़रूरी है कि हम मुझे किस लेवल तक पहुंचना है, नंबर 1, और मुझे ये काम क्यों बोला जा रहा है, व्हाई एम आई आस्क्ड टू डू दिस. दैट पेशेंट फॉल, बीट फ्लिबाइटिस रेट, बीट प्रेशर अल्सर्स, प्रेशर इंजरीज रेट, हाउ दीज आर टू बी seen. Number 1, where am I safe, where my patient is safe, and why it is important. Link it to the organizational goal, because this is something which probably the seniors in nursing, the in charges, team leaders, managers have to understand how this is to be linked with my organizational goal, right? इसमें better outcomes, patient जो हमारे हैं, my organization as well as my quality standards. These are all interlinked. अपनी सोच को सिर्फ उतना तक मत रखिए कि पेशेंट को फ्लिबाइटिस हो गया है तो मैं एक फॉर्म में एंटर कर दूं और मेरा काम खत्म. नो, दिस इज व्हाट वी नीड टू नो, दैट इट इज एवरीथिंग गेट्स डायरेक्टली एंड इनडायरेक्टली लिंक्ड विद ऑर्गेनाइजेशनल नीड्स. एंड विद दिस आई कम टुवर्ड्स द एंड ऑफ माई सेशन. आई विल वेट फॉर few seconds to take any questions or any comments from the group. Any questions? No, nothing. All right. So these are few references, those who are interested, because these had been the building blocks for this session. You can always pick it up, and you want to take a photo, click. All right, all for you. And the last slide. Okay. Thank you very much. Thank you, madam.
Ma'am, your phone. Ma'am, your phone. Thank you so much, ma'am, for such an explanatory, informative, and power-packed session. Agreed, everyone? Now, I requesting Anil sir to present the memento to Captain Sandhya Shankar Pandey. Welcome.
What a pleasure.
Thank you, ma'am. Thank you, sir. Going forward and coming to an end of the conference, it will be my pleasure to invite Mr. Abednego Peter Johnson, Nursing Superintendent, Sitaram Bhartiya Institute of Science and Research, New Delhi. He's a passionate nurse administrator and effective mentor. He has actively involved in launching of medical college, 2 nursing college and multi-speciality hospital. He has been a mentor for nursing students to win 30 national awards in sports, academy and culture. He was also an advisor of nursing team and has won 3rd best performing state award for Goa and also won best communication award in nurse segment, hence was a part of the media. He was guided nurses to win national level quiz competition for 3 consecutive years, 2018, 19 and 20. Sir has successfully completed more than 6 NABH inspection. Please welcome our eminent speaker, Mr. Johnson. We look forward to his rich presentation. Nursing going digital.
Very good afternoon to everyone. Thanks a lot for this good applause and all. I've been so much blessed with this kind words, and I bring greetings from Sitaram Bhartiya Hospital, from the management, from the nursing staff, and to Yatharth Hospital. Thanks to Shinu ma'am for organizing such a good event. I mean, while after the post lunch we were just discussing and we understood that this type of event has not happened in the last 3-4 years in Delhi and NCR. So nice that we are having such a good event. And this gives a very good platform to see our old nurses who have become leaders and been placed in different hospitals. And when we come here for the conference like this, we get together to see them, get motivated that the seedlings, the seeds what we have sowed has been sprouted out as a big trees. So nice to see that. Right. I've been given a topic. Before I start, one more thing. It's nice to see so many male nurses sitting in front of me and the sides, because before 20 years, I have given an interview in the Hindustan Times saying that when I say to the patient that I'm a male nurse, they say, male nurse? Brother? Kiske brother ho aap? So like that they used to say. So now it's very good to see that I have a lot of brothers sitting on my right and left. So a lot of male leaders have come inside. Thanks for that. Thank you. So I have been given a responsibility to talk about going digital. So this is a very interesting topic. And if everyone knows how to operate your mobile phone, I think I have finished my topic. So do you all have a mobile phone, smartphone? Sure about this? You know to operate it? No, one face is saying I don't have. Okay, so if you have this, I'm sure I've gone through the topic. Okay. But still, we'll just go to depth of it, that how digitality helps in nursing and how nursing helps in digitality. Right. Now, what do you understand by going digital? What do you understand by digital? We have a mobile phone. In the mobile phone, what we see is that we see something called a data. We see something a data. The outcome of someone who has entered it, that is seen, that is data. Am I right? अब जैसे मैम ने बोला, मैं हिंदी और इंग्लिश में मिला के बात करूँगा कि अब जो फ़ोन में जो देखते हैं, किसी ने डेटा एंटर किया है या आपने एंटर किया होगा डेटा, उसका जो द प्रोसेस्ड पार्ट जो होता है वो हम देखते हैं, उसे बोलते हैं डिजिटल थिंग. एंड यू कैन सी इट ओपन इट एनी टाइम. लाइक यू हैव ए डिजिलॉक, अ सॉफ्टवेयर इज देयर. ये डिजिलॉक में आपने अपने सर्टिफिकेट्स डाल के रखे हैं. आपने आप दुनिया में किसी भी कोने में जाओ, जब खोलोगे तो दिखेगा. तो आपके सर्टिफिकेट सब डिजिटलाइज्ड हो गए हैं. आपने जिस जिस संस्था में काम किया है उस संस्था के सर्टिफिकेट, कॉलेज हो, नर्सिंग कॉलेजेस हो, बोर्ड हो, उसके कॉलेजेस के सब सर्टिफिकेट्स में आगे में एवरीथिंग गॉट डिजिटलाइज्ड. राइट. नाउ विल गो फॉर what do you mean by going digital? It says that the process of adopting digital technology to help in improving and in streamlining the healthcare system. So बहुत सीधी सी बात है कि ये एक प्रोसेस है. इसमें क्या करते हैं हम कुछ चीज़ों को स्ट्रीमलाइन करते हैं और उसी से हम वी ट्राई टू इम्प्रूव दैट स्ट्रीमलाइन डेटा. फॉर एग्जांपल, एक नर्स इमरजेंसी में जाती है, 4-5 बेड रखे हैं उसके पास. 4-5 बेडों में 5 प्रकार की मशीनें लगी हुई हैं. कार्डियक मॉनिटर कॉमन होगा, इन्फ्यूशन पंप लगे हुए हैं, उसमें कुछ दवाइयाँ चल रही हैं. वी हैव small digital meters are there, including thermometers are there, small thermometers are there. Those things are there. But in one shift, one nurse comes to know across all this equipment what is there. The next shift nurse will not know what this girl has seen unless she makes sure that she marks all this data inside the computer or in the paper, or this computer automatically marks itself in the digital coding sheet. Right? जैसे कि कार्डियक मॉनिटर, आजकल के कार्डियक मॉनिटर जो होते हैं वो सभी जगह लिंक होकर एक ही स्क्रीन में दिखाई देते हैं. एक नर्स एक जगह बैठ करके सब कुछ देख सकती है. ये ऑटोमेटिकली उसका जो रेस्पिरेटरी रेट होता है, पल्स रेट होता है, सब कुछ अपने आप हर मिनट में या 15 मिनट में इस सिस्टम में ऐड होते जाता है. इसके कारण फ़ायदा क्या पड़ता है, एक नर्स को बार बार जा करके उसे देख करके एंटर करना नहीं पड़ता, क्योंकि सिस्टम से डायरेक्टली द सॉफ्टवेयर अब्जॉर्व्स इट एंड gets recorded in this system. So tomorrow, when an XY nurse comes inside, when she opens up, she will understand that. When she owns the data, she will understand that one, that what and all readings are there. Right. So exactly the same way. Okay. Now, I said about digital technology. Now, what is digital technology? It has electronic tools, systems, devices are there. A lot of resource gets generated in that, and all this get processed in a form of a data. So this is called as a digital technology. Do you understand? In this technology में हम जो electronic tools, जैसे मैंने कहा आपके छोटे छोटे systems जो होते हैं, ग्लूकोमीटर हुआ आपका ABG मशीन छोटा वाला हुआ, बिलिरुबिन चेक करने के लिए मशीन हुई. So all these small machines which is there, when it all gets linked together, this is a small digital machine which we link together, this technology gets used for a common purpose in a healthcare system. Is that very clear? Till now we are clear? Okay. Now, what do you mean by digital healthcare system? आप लोग डिजिटल हेल्थ केयर सिस्टम में हो या नहीं हो? Yes, हम लोग हैं. क्या क्या करते हैं डिजिटल में हम लोग आजकल? क्या क्या करते हैं डिजिटल हेल्थ केयर सिस्टम में हम लोग? बेड साइड लेके जाते हैं सिस्टम को. वेरी गुड. और मेडिसिन इंडेंट करते हैं. वेरी गुड. सैम्पलिंग्स, रिक्वेशन रेज करते हैं आप. वेरी गुड. सो आई मीन अ प्रॉपर digital healthcare system is something which is accessible to everyone. It should be affordable to everyone, and it should be that system which we have received should be sustainability should be there. For example, हमने एक सिस्टम ले लिया है, हम चाहते हैं कि इसमें हम काम करें. इस साल काम करने के बाद अगले साल हम बोलते हैं, मैं तुम्हारी मैडम आके बोलेगी कि हमें इस पे काम करना है, तो आप क्या बोलोगे कि मैम कल तो आप एक्स सिस्टम लेके आई थी, हम कल उसको सब मुश्किल से सीख गए 6 महीने में, आज आप बोल रहे हो आप जेड पे काम करने के लिए, कल आप बोलोगे वाई में काम करने के लिए. भेजा फटे जा रहा है. You get confused, right? So you also get, so a best healthcare system is something which remains stable, जो stable रहे, जो accessible रहे, और बहुत बदलाव ना दिखाएं, एक ही जैसा चलते रहे वो. ठीक है ना? Okay. Now, hospital uses few systems. हॉस्पिटल यूजेस अ फ्यू सिस्टम्स. हम उसको बोलते हैं इलेक्ट्रॉनिक मेडिकल रिकॉर्ड्स, उसको बोलते हैं हॉस्पिटल इंफॉर्मेशन सिस्टम, कुछ बोलते हैं इलेक्ट्रॉनिक हेल्थ रिकॉर्ड, कुछ बोलते हैं पर्सनल हेल्थ रिकॉर्ड. ये सब चीज़ें एक ही जैसी होती है, थोड़ी ऊपर नीचे चीज़ें हैं. जैसे कि इलेक्ट्रॉनिक मेडिकल रिकॉर्ड में आप आए हॉस्पिटल में, आप इमरजेंसी में आए, आपके पेशेंट का रजिस्ट्रेशन हुआ, वहाँ पे एक नंबर जनरेट हुआ, नया पेशेंट है तो वहाँ से पेशेंट जब वार्ड में जाएगा तो वही जो डिटेल्स जो इमरजेंसी में जो डॉक्टर ने एंट्री की थी या जो आपने हिस्ट्री बताया था, वो चीज़ आप देख सकते हो जब आप ऊपर वार्ड में आओगे. तो उस डॉक्टर को परेशानी ना होगी कि वो पेपर देके फिर से निकलता रहे. नाउ when you see if a complete EMR is been implemented, we use just 1 to 2% of paper where the patient has to put a signature, or you have any reports which you have taken from other hospitals which has been come inside. Otherwise, everything is been in the system. You don't have to worry about any paperwork at the time of a discharge. You don't have to make a big file, carry and file every rounds. You don't have to carry a file. You just need to take a palm top, or you can take a laptop, or you can roll a cow towards the patient side. Okay. Okay. So cow is a computer on wheels. So we have a laptop which has been fixed on a trolley. That trolley is on the top, and we can mobilize. This trolley is attached to the Wi-Fi, and Wi-Fi gets attached to the EHR and HIS system, electronic medical record, and or hospital information system. So we can pull this trolley towards the patient side. It will have a barcode. So a patient will have a tag. Patient band is there. You can just scan the band, and you can just start giving medicine. The system will not open unless the band, the barcode gun suits with the barcode what the patient is having it. So it makes a mistake proof thing, right? Should have brought a cow. Now, आपने सुना होगा बहुत दिनों से बात हो रही है आर्टिफिशियल इंटेलिजेंस AI, चैट GPT आ गया है, AI चीज़ क्या होती है? What is artificial intelligence? It is making a system or a machine. It's a way of making a machine or a system which can think like a human being. For example, एक सिस्टर ने एंटर किया कि RBS पेशेंट का 65 है. अब उसके बाद एक दूसरी मेडिकेशन नर्स जो है वो बिना सिस्टम देखे अगर वो जाती है कुछ मेडिसिन देने के लिए, क्या देने के लिए? मेडिसिन देने के लिए, without giving, I mean, she's somewhere, the assigned nurse is giving medicine to somewhere else. She will not get stuck because the AI जो बोलेगा, आर्टिफिशियल इंटेलिजेंस सिस्टम जो बोलेगा, अलर्ट देगा सिस्टम में कि आप पहले जाके इस पेशेंट को, आप हाइपोग्लाइसीमिक के लिए जा रहा है पेशेंट, उसको पहले आप ट्रीट करो करके वो अलर्ट देगा. ठीक है ना? और बहुतों में SMS भी भेजेगा. जो सुपरवाइजर रहते हैं उनके मोबाइल में SMS आता है, पेजर है, पेजर में मैसेज आता था. तो इस तरह की जो चीज़ें हैं ये सिस्टम खुद बोलता है कि आप ये काम मत करो. फॉर एग्जाम्पल, there's a patient who has been shifted to the operation theatre. The patient is not available in the ward. Now a nurse is there who wants to receive the patient. So when she goes to the patient side, the system will, before she goes and receives the patient, she will know in the software that what are now medicines are running for her. Now there are a lot of apps are there. Systems comes with the apps also. Even the nurse who comes for the duty, before coming for the duty, she will know what type of patient has been assigned to her and what type of a patient she is going to get and what is the patient work she has to plan for karke also. Okay. The AI can do the things very smartly, and it can process large amount of data together, and it can recognize patterns. For example, एक डॉक्टर टेक्नीशियन ने MRI लिया पेशेंट का, MRI लेके जैसे उसे अपलोड करेगा सिस्टम खुद बताएगा कि इसका क्या डायग्नोसिस है करके, क्योंकि उस तरह के पैटर्न्स जो होते हैं वो ऑलरेडी सिस्टम में सेव्ड हैं और कंप्यूटर चेक्स द पैटर्न एंड सेज व्हाट इज रिजल्ट. फॉर एग्जांपल, नॉर्मली यू टेक ECG मशीन, ECG लेते हुए पेशेंट का तुरंत उसके ऊपर एक डायग्नोसिस निकलता है, लेफ्ट साइड या राइट साइड में एक डायग्नोसिस निकलता है. दैट इज़ व्हाट द आर्टिफिशियल इंटेलिजेंस इट इज. हमने मशीन इस तरह बनाया है कि आपको देखते ही उसका बिफोर यू गो टू द डेप्थ ऑफ इट, द मशीन इटसेल्फ सेज what is the type of rhythm seen inside that one. Okay. Now this helps you to judge, and this helps machine also takes judgment, and machine says that you can do this thing karke. Right. Now ये सब चीज़ें की ज़रूरत ही क्यों है? Now डिजिटल नर्स बनने की ज़रूरत क्यों है? आने वाला समय डिजिटल है. वेरी गुड, वेरी गुड, वेरी गुड. आने वाला समय डिजिटल है. विदाउट डिजिटल यू कैन नॉट वर्क. वेरी नाइस. एनीथिंग एल्स? It is to save the life of a person. Very true. It's a life-saving tool. We need to use it off. Time-saving है. Very good. Perfectly thing. Easy to use है. Very good. It is beneficial in every way. Less chance of error. Very nice. Wow.
he gets trouble so much with the quality entry data, so it really helps. It helps him. What else? Yeah, you can store a lot of data in that which can be used somewhere. Not now, in future it can be used. Very nice. I mean, you're taking off all my classes. So nice. So nice. What else can be there? Very true. They say that we cut a lot of trees. We cut, in urban health, sitting in the office, we cut a lot of trees. How do we cut is by using the papers, what we use. So naturally, we are not going to cut the trees and all, but when you consume their papers, because of us, someone's cutting the trees there. So we are saving Mother India. Yes or no? Very nice. What else? Very nice. अब क्या है कि ना मेरे से पहले जो भी एलिट मैम्स आई थी उन्हें बहुत सारी चीज़ें कहीं कि किस तरह के नर्सेस होनी चाहिए, होती हैं, होना चाहिए, किस तरह चीज़ें काम करनी चाहिए करके. अब 200 इन 1960s के दशक में अगर देखेंगे तो पब्लिक क्या मांगती थी कि हमें एक नर्स चाहिए, बस हॉस्पिटल में एक नर्स चाहिए, उन जैसे भी हो नर्स हो जो ठीक है. उसके बाद आया 90s 80s तो उन्होंने बोला कि हमें नर्स तो चाहिए, उसके साथ में एजुकेटेड नर्स चाहिए हमें. वी वांट GNM एज अ बेसिक डिग्री एंड हमें GNM नर्स चाहिए. ये बहुत बेसिक हो गया. उसके बाद आते आते जब 2000 आया तो उन्होंने बोला कि हमें नर्स तो चाहिए, वो एजुकेटेड भी होनी चाहिए और साथ में लाइसेंस्ड भी होनी चाहिए दिल्ली नर्सिंग काउंसिल में या यहाँ यूपी नर्सिंग काउंसिल में. इसके बिना हम नर्स को मानेंगे ही नहीं, तुम नर्स ही नहीं हो तुम. अब जब ये आगे आगे चलता गया, जब हम पहुँचे अराउंड 2010 में पहुँचे तो बोले कि वो सब ठीक है, तुम हार्ड वर्किंग हो कि नहीं हो. तो बोली अरे सर मैं तो कपड़े फाड़ के काम करती हूँ, आप कितना भी करा लो, इतना काम कराती हूँ करके. तो वो एक ट्रेंड चला था बीच में. उसके बाद आया कि हमें हार्ड वर्किंग नए नर्स नहीं चाहिए, हमें चाहिए वो नर्स जो स्मार्ट हो, पेशेंट का टाइम जो है उसका उत्तर दे सके और अपना काम भी ठीक रखे. मैडम जब राउंड्स में आए तो सही उत्तर दे सके और हंसते रहे. हंसी नहीं जानी चाहिए, घर में 1000 प्रॉब्लम हो लेकिन हंसी नहीं जानी चाहिए. तो वो उसके लिए भी नर्सेस तैयार हो गई. अब हम पहुँचे हैं डिजिटल नर्सिंग की तरफ. तो अभी के नर्सेस को क्या क्या होना चाहिए? शी हैज़ टू बी नर्स, शी हैज़ टू बी एजुकेटेड, शी नीड्स टू बी लाइसेंस्ड, शी नीड्स टू बी हार्ड वर्किंग, शी नीड टू बी स्मार्ट वर्किंग एंड शी नीड्स टू बी अ डिजिटल नर्स. So that's how we should be. So घर में भी डिजिटल ही होना पड़ेगा. नहीं तो आज हमारे जो छोटे छोटे बच्चे हैं वो हमसे ज़्यादा डिजिटल है, मोबाइल दिखा के ऐसे ही सिखा देते हैं हम लोगों को. Okay. Now you have said a lot of good things about the benefits about the digital nursing. I have mentioned few things about this. It says about a hospital promotion. It helps in hospital promotion. For example, I'm sorry. For example, a gentleman who is sitting here, probably he's sitting in I'm sitting in the 8th floor and taking care of the patient. A gentleman who's sitting in a ground floor and the first floor can with a single click can say that how many patients have got discharged, giving a rating of 5 to the nursing department or to which type of department it is. So that much the artificial intelligence, that much the digitalization helps in. Okay. Now interface of a modern devices. Now there are a lot of machines comes. If we start writing the temperature, you remember one time used to be there, early morning at 6 o'clock sister used to write the temperature of the patients. 8 बजे डॉक्टर राउंड बड़े डॉक्टर के आने से पहले तुरंत आ करके नर्स का नोट्स धीरे से देख के नोट कर देता कि यही बीपी होगा, यही टेम्परेचर होगा, यही होता है. वो आपको याद है वो सब चीज़? ठीक है. अब नर्स ने खुद वो बैठे बैठे या सो के लिखा दूसरी बात है, लेकिन डॉक्टर ने ज़रूर नोट किया कि वही टेम्परेचर नोट किया है. ठीक है ना. अब इस तरह की जो चीज़ें होती है ना, ये सब इसमें घट जाती है क्योंकि मशीन ऑटोमेटिकली पिकअप कर लेता है और स्टोर कर लेता है. बस आपको बस पेशेंट का एक स्टेटस जानना है, करंट स्टेटस क्लिक करोगे तो पूरा स्टेटस उसमें निकल के आ जाएगा आपको कि क्या है, दूध कहाँ है, पानी कितना है करके क्लियर निकल के आ जाएगा इसमें. ठीक है ना. अब तीसरा है कि रीचिंग नर्सेज ड्यूरिंग द मेडिकल इमरजेंसीज. नाउ वी हैव अ कोट्स इमीडिएटली व्हेन द वाइटल साइंस फॉल्स डाउन बिलो द नॉर्मल थ्रेशहोल्ड, जो आपने सेट करके रखा है उसके नीचे जाना, अपने आप सिस्टम ही कोड बुक डिक्लेयर कर देता है. टीम वहाँ पहुँच जाएगी. असाइन नर्स को मालूम नहीं होगा कि टीम वहाँ पहुँच रही है, फिर वो देख के भागेगी क्या हुआ करके जब तक अनाउंसमेंट शुरू होगा. सो इतना एडवांसमेंट आ चुका है. ठीक है ना.
अब मैनेजमेंट ऑफ ड्रग्स तो बहुत आसान हो गया है, क्योंकि पहले क्या होता था कि पहले डॉक्टर आकर के अपने प्रोग्रेस नोट्स में ड्रग्स लिखता था। इसको एग्जाम्पल सबसे सिंपल दवाई पैरासीटामोल दे दो, सिस्टर उसी पैरासीटामोल को दवाई ले करके सिस्टम में बैठ करके पैरासीटामोल देखती थी सिस्टम के अंदर। अब वहाँ पैरासीटामोल की दवाई दिख ही नहीं रही, तो फार्मेसी वाले को फ़ोन करेगी, फार्मेसी वाला बोलेगा सर वो पैरासीटामोल के नाम से नहीं है, कैलपॉल के नाम से है करके। अच्छा कैलपॉल के नाम से, ठीक कैलपॉल के नाम से। अब इस सिस्टम के कारण क्या हो गया, ये सब फंडा खत्म हो गया है। डॉक्टर खुद रिक्वेस्ट करेगा, वो अपने आप जैसे ही सेव करेगा अपने आप इंडेंट हो जाएगा। जैसे ही इंडेंट हो जाएगा आपको 5 मिनट के बाद क्या होगा, दवाई ऊपर आके बोलेगा मैडम आपका मेडिसिन। तो जब तक आप अपना इनिशियल असेसमेंट खत्म करके बाहर निकलोगे, वहाँ पे फार्मेसी लड़का खड़ा होगा या एक शूट में जेट जैसा आके एक पाउच आ जाएगा, उसमें लिखा होगा कौन सा मेडिसिन देना है करके आपको, ठीक है ना। जब वो खत्म हो गए, अब पहले एक और शैतानी करते थे डॉक्टर लोग, क्या करते थे कि एक कोई इन्वेस्टिगेशन है, पेशेंट आगे बैठा है, स्टाइल में आईफोन खोला और देखा कुछ इन्वेस्टिगेशन का नाम, कुछ समझ आया, उनको भी कुछ समझ आया, तो उन्होंने पेपर लेकर के कुछ कैसा ऐसा लिख दिया इन्वेस्टिगेशन का नाम, लिख के वो चले गए। अब नर्सिस बैठ के सर फोड़ रही है कि ये इन्वेस्टिगेशन का नाम क्या है। हैंड राइटिंग अरबिक भी लग रही है, हिंदी भी लग रही है, अंग्रेजी भी लग रही है, बीच में तमिल भी लग रही है। सुपरवाइजर को बुला के पूछा, सुपरवाइजर फ़ोन लेकर के अभी और सिस्टम करके चली गई। अब वो किससे बात करेगी। अब इस AI के कारण क्या हुआ है, हर डॉक्टर को जो इन्वेस्टिगेशन चाहिए होता है वो खुद क्लिक करता है और एंट्री कर देता है। हमें उसके बाद हमें एक ऑर्डर आता है कि डॉक्टर हैज़ गिवन फॉलोइंग ऑर्डर, हमें बस उसे बारकोड जनरेट जो करके उसे बस निकालना पड़ता है हमें, यानी वो डुप्लीकेसी वर्क भी गया है कि नहीं। तो AI से इतना फ़र्क पड़ता है और डिजिटल इंडिया से और हेल्थ केयर स्टाफ में इतना फ़र्क पड़ता है, ठीक है ना। वी गो फॉर लॉट ऑफ एरर्स गोस मिसिंग, patient safety stands in the priority. We go for real time seamless hospital. Like for example, एक तुम्हारी मैडम है, वो सिस्टम बैठे बैठे बिल्कुल अपडेटेड रहेगी कहाँ पे कौन सा पेशेंट है, किस में क्या हुआ है, कहाँ पे। आपको जा करके 3-4 बजे को जा करके वहाँ पे ड्यूटी जब खत्म हो रही है, अंदर जाऊँ, मैम का मूड कैसा है, ठीक है, ख़राब है, मैम घूर रही है, गुस्से में है, ये सब जनी टेंशन ही नहीं है। बिकॉज यू नो that she has seen all these things in the system and she is updated. You need to just go and say, tomorrow I have planned for this, that's it. She'll be very happy because she has updated you. ठीक है। Now, मैम बहुत सारे स्टाफ हंस रहे हैं ठीक है। Now, there are a lot of points are there. You can have a response, you can expedite the response of yours to the patient side. पेशेंट ने डाउट पूछा, फॉर एग्जाम्पल हमारे हॉस्पिटल में एक सिस्टम लगा हुआ है, सब बड़े हॉस्पिटल सब में लगा होता है कि पेशेंट बोलता है कि कितनी देर से बुलाए हूँ, कोई आया ही नहीं यहाँ पे मेरे से मिलने के लिए। तो हमारे पास कॉल बेल लगा होता है, हम तुरंत एक कंप्यूटर से पेपर निकल जाते हैं, मैम बस 15 सेकेंड हुआ आपको कॉल करके। मैम नहीं मैंने बहुत पहले, तुमने कॉल नहीं बजाया था, नहीं तुम पत्नी पति से पूछती है, तुमने कॉल बेल बजाया नहीं था, नहीं मैंने बजाया नहीं था, मैंने सोचा तुमने बजा दिया होगा। अब बात ये कि उनकी इच्छा हम समझ भी नहीं सकते कि वो हमें चाहते हैं करके। प्राइवेट रूम्स बने हुए हैं, एक कमरे के अंदर दूसरा कमरा बना हुआ है, उनके अटेंडर्स बैठे हुए हैं। अब उनकी फीलिंग को सच करने के लिए हमारे पास सिर्फ एक डेटा बिल्कुल बच जाता है, दूध इतना है मैम, पानी इतना है करके हम उनको दिखा सकते हैं, वो भी हंस करके कोई बात सिस्टर भूल गए होंगे, कोई दिक्कत नहीं, अगले बार बुला लेंगे, आप जाओ करके। तो जब एक बार ये सीक्वेंस हो जाता है, अगली बार हमें भी अच्छा लगता है इसकी तरह बैठने में कि हम भी नर्स हैं करके, ठीक है ना। देन नेक्स्ट इज aiding in prevention care. Preventive care, जो मैम बोल रही थी, preventive care is very important part of it. Now, this all helps us in taking our preventive actions. Now, this preventive action will help us to get a bond with the patient. For example, एक patient का अगर IV fluid है, 100 ml चल रहा है, जैसे ही वो खत्म होता है, अगर उसे 10 मिनट 5 मिनट पहले पहुंच जाओ, 3 मिनट पहले पेशेंट के पास पहुंच जाओ, तो कितना खुश होता है मालूम है कि सिस्टर आप सही टाइम पे आ गई, आप बंद कर देना, मैं सोने वाली हूँ करके। वो जो खुशी होती है ना, वो फिर वो कभी तुम अगले दिन गलत कर दो, वो फिर छोड़ देगा उसका, अरे कोई बात सिस्टर बिजी हो गई, कोई बात नहीं, सिस्टर बहुत सारे पेशेंट देखते हैं यहाँ पे करके। लेकिन जो पहला इंप्रेशन जो होता है ना, वो तगड़ा होना चाहिए आपका, वो सबसे इंपॉर्टेंट होता है आपका, ठीक है। नाउ इनहैंस पेशेंट आउटकम्स एज आई डिस्कस्ड ऑलरेडी, इंक्रीज हॉस्पिटल ट्रस्ट. Now we have a software in our hospital. We have a patient software also. Patient can open his mobile phone and he can check his vitals. He can check what medicine is gone. He can check what doctor has diagnosed him. So all these things patient can check from his mobile phone. इससे क्या फ़र्क पड़ता है? ट्रांसपेरेंसी बनी रहती है। वो बार बार आके नर्सिंग स्टेशन में आके सिस्टर ABC क्या होता है, EF क्या होता है, वो क्या होता है, ये क्या होता है, परेशान बिल्कुल नहीं करेगा आपको, क्योंकि बहुत सारी चीज़ें उसको ऑलरेडी मालूम है क्या क्या चीज़ें हैं करके इसे, ठीक है ना. देन है data security is very important part of it. We have lot of data going inside because probably we just now she was saying how she has more than 300 nurses. All the nurses are putting on data they are giving in there. This all data are secured, but it is not showing you or not causing you trouble. But जब भी आप इसको चाहेंगे वो data वहाँ से निकल के आके आपको मदद करेगा, ठीक है ना. You can go in the depth. 6 साल के बाद भी आप जाके सर्च करोगे कि क्या गलती हुई थी इसमें, आप उसमें देख सकते हो सिस्टम में क्या है करके, तो उसमें मदद करता है इसमें, ठीक है. Then make your hospital clinically advanced. You will feel more advanced. Doctor can sit on the nurse station. Suddenly डॉक्टर के पास एक पेशेंट पहुंच गया और पूछा मेरे पेशेंट की तबीयत कैसी है सर, डॉक्टर साहब बताओ आप. तो तुरंत he needs to just open the system. He can say what is the condition of the patient right now to the patient. तो सर आप तो ऊपर आए नहीं, 3 घंटे से बैठे हो, हमें सब informed है. Like that he can say or she can say this one, ठीक है ना. That's how it helps. Now, improve data management, electronic, I have already spoken about this. Okay. Now, this also helps the management, us, that we can plan the staff accordingly. For example, हम लोग रिक्शा पकड़ के चलते हैं कि एक वार्ड में 6 पेशेंट्स के लिए एक नर्स होनी चाहिए करके. तो हमें बैठे बैठे पता चल जाता है कि कहाँ पे कितना पेशेंट डिस्चार्ज हो रहा है, कितना पेशेंट रहेगा, अगले शिफ्ट में कितना नर्स रखना है, कितने पेशेंट 1 घंटे के बाद निकलेगा, 2 घंटे के बाद निकलेगा, या OT से कितना पेशेंट वापस पहुँचेगा. उसके अनुसार से इट हेल्प्स अस इन गिविंग अ स्टाफ प्लान टू दी पर्टिकुलर डिपार्टमेंट्स, ठीक है. नाउ दिस आर द फ्यू बेनिफिट्स ऑफ what is use of this digital health? At last, what is the use of this digital health? It helps us to prevent disease. It helps us to improve the quality of a life. जैसे disease में हमें मदद करता है DIS को निकालने में और ease पहुंचाने में पेशेंट को. हमारा काम ही यही है कि हम पेशेंट के साथ रह करके उसमें जो प्रॉब्लम है, डिस है, वो डिजीज़ से आता है और ईज से जाता है. हम पूरी कोशिश करते हैं ये जो सिस्टम है, जो डिजिटलाइजेशन ऑफ नर्सिंग है, वो उसमें पूरी तरह मदद करता है, बहुत उम्दा मदद करता है उसमें, ठीक है ना.
Artificial intelligence
I have
is
a small video.
revolutionizing medicine. But how can this potential be used in the best possible way? For example, if a patient is worried about their health, they can quickly obtain initial diagnoses with a symptom checker app. The app also helps patients decide whether they should see a specialist, and if so, which one. The app's algorithm provides the doctor with valuable information for taking the patient's medical history, even in the case of rare diseases, and it can support the choice of the right treatment. Artificial intelligence can be useful during an Artificial intelligence is revolutionizing medicine, but how can this potential be used in the best possible way? For example, if a patient is worried about their health, they can quickly obtain initial diagnoses with a symptom checker app. The app also helps patients decide whether they should see a specialist, and if so, which one. The app's algorithm provides the doctor with valuable information for taking the patient's medical history, even in the case of rare diseases, and it can support the choice of the right treatment. Artificial intelligence can be useful during an MRI examination, for example. MRI images consist of hundreds of thousands of individual image data in which neural networks recognize patterns and calculate the probabilities for certain diseases. To do this, they were previously trained with numerous MRI images and the associated diagnoses. The AI-supported assistance systems provide the doctor with important information for her own diagnosis. However, special skills are required to be able to deal with it in a reflective manner. In summary, these two aspects are particularly important. On the one hand, AI systems must be trained with as much data as possible in order to deliver reliable results. On the other hand, doctors need additional skills to be able to make better decisions in the interest of the patient, supported by AI. In this way, the potential of artificial intelligence for medicine can be used in a reflective and
Well, now after all these things, I want to ask you whether AI or digitalization of healthcare can replace the nurses? Never. Nurses cannot be replaced by anyone. This is okay in that place, but we are best in our place. Unless we don't feed this, this is of useless thing. So you are the most important monitors and mentors of your patients. Right. Well, I'll like to take on any questions, any clarification if it's further needed, please. Thank you. So nice.
Thank you, Mr. Johnson, for such an enlightening talk. We really, really enjoyed it. Agreed, everyone? Learning is a continuous process and a never-ending journey. However, I'm so sorry. I will request Mr. Shinu Varghese to present a memento to Mr. Johnson. Please welcome on stage. Thank you, ma'am. Thank you, sir. Learning is a continuous process and never-ending journey. However, we have to end the day. The day enriched us with knowledge and Nursing Connect. Now I request our unit head, Anil Viti, sir, to extend vote of thanks. Welcome, sir. Good evening, everyone. कैसे रहा? हाँ, बढ़िया. आई थिंक जॉनसन का सेशन सबको अच्छा लगा होगा, क्योंकि सारा काम हमारा दूसरा कोई करेगा, है ना? कोई डॉक्टर करेगा, कुछ सिस्टम करेंगे, कुछ एआई टूल्स करेगा, हमको तो कुछ करना ही नहीं है ना? So good. So very good. So moving to my official formality. I just want to ask you, how was the session today? Excellent. Double excellent, okay. But anybody want to share your experience? Yeah, please. On. Okay. Very good. Thank you. Anybody else? हाँ, आराम से.
हेलो. ये टेक्नोलॉजी के प्रॉब्लम है.
Okay, to add on what Sir said, this is the technology program. The critical thinking that the nurses has can never be replaced by AI. We, the critical thinker, has to pen it down in the system to get the work done. So as Sir said very well, nurses can never be replaced. They would come when everything would be done on the system, but still we nurses would lead the forum. Thank you. It was a wonderful session here. Thank you so much.
इस साइड में कोई नहीं है? हाँ, नहीं, ओके, चलो. So we are here since morning, almost like काफ़ी सारे लोग 9 o'clock से आए हुए हैं, and we started the program around 10:30, and we have around 6 sections altogether all the day, right? I think आपने काफ़ी कुछ learn किया होगा, maybe आप बताना नहीं चाह रहे होंगे. So on a lighter note, I mentioned like AI and digital technology. So that's the future. It's going to be the future. But at the same time, nurses cannot be replaced. That's also a fact. But at the same time, one more thing we need to understand. In corporate world, I worked almost like 30 years. Most of the time I was in corporates only. And this hospital was started with a private limited company in 2008 with around 100 beds. But in few years later, today, we are 1400 plus bed capacity hospital. And similarly, and we are a listed company today. At the same time, we were going, somebody mentioned like this program is very success. I'm very proud of, I'm very thankful to that. Similarly, I'll tell you one thing, the way of Yatharth is a bit different compared to any other hospital. Like while we were going for IPO, we were confused like, okay, whether it is going to be, how it is going to be accepted. There are a lot of healthcare hospitals are there, like the legends are there, and we don't know. And we are kind of a regional hospital. We are only in some part of the North India, and not even in Delhi. So how we are going to be like taken in the market, like maybe in national level or international. Believe me, like the result which we are on the IPO day, that final day, we were shocked. The IPO has been oversubscribed by 37%, which is a very, very huge success. Right? Similarly, even internationally also, we got very good response, because 2 markets are actually internationally in Asia, we say it's like Singapore, and in India, Bombay is the hub. But in both places, we are recognized like anything. At the same time, who were there in the beginning, we only few months, like around 4-5 months back only we listed. So I'm saying, till the people are with us, our share still, it was launched by 306 rupees. Still, it's in the upward graph only, right? Similarly, 2 months back, I was sitting with my team, core team, and we were discussing, okay, what are things we need to do? And we are always there for quality and other stuff. So Sheenu came up with the idea, like we'll do a CNE. The same moment, all of us agreed, we will go for it. Okay? Then I had a discussion with my director, Mr. Yatharth. There was no discussion, debate, he agreed, go ahead. From that day, we decided, okay, we will do it. We wanted to do it a grand success. This success I saw the day one. And I'm seeing, experience it in today, because I dreamed that, and whatever way I visualize things, the same thing happened today. And I was demanded 2-3 things. I was very, very demanded, a lot of things I demanded, lot of points I pushing with her. Like, I was talking about the speakers, I need this kind of representation. And lot of discussion happened. I said, no, I don't want this, I need this, that, all those things. Second, the participation of the hospital. Today I'm very happy because we have a slide also here. Like all Delhi NCR hospital participated in this one-day conference. We just taught a small CNE, then we converted that into a completely full-day conference.
And we mentioned in the lunch also today, like most of the hospitals today is not focusing these things. And almost like last 3 to 4 years, nothing, this kind of scenario happened in Delhi NCR at least. Similarly, like we heard, every day we are talking about like doctors' conferences, CNEs, which is happening every time. Today also I have one in the evening. Okay, but at the same time, nursing conference is kind of a different, it's very rare, but that is very vital to the organization, but nobody will pay attention to the nursing side. But in Yatharth, it is not like that. We are paying attention to the nursing, and you probably in the opening slide of Shinu must see 73% of my nursing staff today is more than 3 years experience. At the same time, while we started, we were struggling. And क्या बताऊँ, मेरे को बोलने का कोई बुरा नहीं है, मतलब ऐसा लगता है ANM के साथ भी हमने शुरू में काम करना शुरू किया था इस हॉस्पिटल में. But today we don't have anyone in the bedside, and I'm proudly मैं ये बता सकता हूँ 3 साल से ऊपर एक्सपीरियंस 73% लेके काम करना कोई जॉब नहीं है ना? Yes. So similarly, in the morning session, Mr. Yatharth mentioned about what's our dream. We are going to be 3,000 plus bed hospitals in next 3 years' time. We'll be adding more hospitals, we will be expanding. This is right now 450 bed hospital right now. We are planning to upgrade this hospital to 700, 750. That's a plan. And we do almost all the high-end things here, like from another thing which is very interesting here is actually most of the hospital don't give focus to the mother and child. So they have separate vertical. For example, Fortis have LAFM, right? Apollo, they have Cradle, and Cloud9, etc., etc. But there's a different segment of gynae. But we have a very dedicated, full-fledged department for mother and child. And we do everything in pediatric. But even though some specialties actually it's not what you call revenue earning. We were discussing about child development center, which is very, very rare in even India. I'm not talking about even NCR. It's very rare in India. Similarly, we have fetal medicine kind of thing. So that's another specialty which is actually kind of a future for the mother and child department actually. Anyway, I'm not काफ़ी ज़्यादा बोर नहीं करा रहा हूँ. मेरे को लग रहा है ज़्यादा हो गया. So लोग को लग रहा होगा यार मैं अपने आप को प्रमोट कर रहा हूँ. No, it's not like that. So थोड़ा एक्साइटेड हो गया तो ऑब्वियसली हो जाते हैं, है ना? सो एनीवे मैं थोड़ा अपना ऑर्डर चेंज करना चाह रहा हूँ. सो वोट ऑफ थैंक्स नॉर्मली जो हम बताते हैं गेस्ट के साथ शुरू करते हैं, मैं उसको थोड़ा चेंज करना चाहता हूँ विद योर ऑल परमिशन. एग्री? ओके. मैं पहले थैंक यू बताना चाह रहा हूँ शीनू वर्गीस को, क्योंकि ये थॉट नहीं आता है या उस समय हमने इसके बारे में नहीं सोचते हैं, तो हम लोग अभी ये बैठ के मेरे को ये अपॉर्चुनिटी नहीं मिलते हैं ये सबके सामने खड़े होने का, है ना? सो एंड शी वर्क लाइक डे एंड डे आउट. सो हमने जो बोला था हमने उस लेवल पे हमने किया. एंड आई थिंक थोड़ा बहुत गलती हो गई होगी, इतना तो हम सब लोग माफ़ कर देंगे, है ना? सो थैंक यू वेरी मच फॉर योर एंड योर टीम फॉर द मेकिंग इट सक्सेस, राइट? Okay, so then I start with Dr. R.K. Mani. So Dr. R.K. Mani क्यों? एक डॉक्टर ही क्यों? एक नर्सिंग कॉन्फ्रेंस कर रहे हैं. सो एक नर्सिंग की चलने में एक डॉक्टर की क्या इंपॉर्टेंस है? या अदरवाइज एक ले तो यशोदा हॉस्पिटल से क्यों? ये भी आते हैं, पूछते हैं ना क्यों? That's again a regional kind of a hospital, regional segment पे चल रहा है, अच्छे खासे hospitals है, right? But he is a very good doctor in terms of, I worked with him also in one of my previous organization. But otherwise also he is a very good speaker. And we were today in the lunch, we were talking about like, ma'am, Captain Sandhya को बता रहा था, आपने मिस कर लिया स्पीच सर की. So मतलब आपको पता है कितना सही तरीके से उन्होंने आपको चीज़ें समझाया, हाँ? So I extend my sincere thanks to Dr. R.K. Mani, and then Colonel Bindu. She came very early in the morning, and we had a very good session with her, and I extend my sincere thanks to her also. And Josephine madam was the third panelist, and she had a very good section with लग रहा है हाँ अच्छा सेशन था पक्का ठीक है okay. And moving forward, Captain Sandhya, मेरे को लग रहा है मेरे को डबल ट्रिपल थैंक यू बोलना पड़ेगा बिकॉज शी वॉज नॉट एबल टू कम फॉर मल्टीपल रीज़न. एक तो अपनी रिलीजियस रीज़न से, बट इसके बाद शी एग्री टू कम ऑन ऑनलाइन मोड. हमने बोला ऑनलाइन ओके. और थोड़ा सा मेरे को पर्सनली भी लग रहा था बिकॉज आई ऑल्सो वर्क क्वाइट लॉन्ग इन 40s. तो मेरे को लग रहा था यार 40s का रिप्रेजेंटेशन नहीं है तो थोड़ा सा अच्छा नहीं लग रहा था. सो बट देन शी न्यू टोल्ड मी लाइक यू कमिंग टू अटेंड, बट थोड़ा सा ऊपर नीचे टाइम का इशू होगा. सो थैंक यू वेरी मच मैम फॉर टेकिंग आउट टाइम एंड गिविंग अस अ वेरी पावरफुल पैक्ड प्रेजेंटेशन. सबसे पहली बात तो लंच के बाद तो हमने ये भी बोला लंच पे क्या क्या मेनू रखे. हमने सीरियसली बता रहा हूँ, वी गोन इन टू दैट डिटेल. बोला किसी ने बोला दाल मखनी रखना नहीं है, उसके बाद नींद आएगा राइट. सो देन शी वन इज सेइंग नो प्रॉब्लम, कैप्टन संध्या विल बी देयर, शी विल बी टेक केयर. मतलब कोई इशू नहीं है सबको, है ना. सो या थैंक यू वेरी मच मैम फॉर दी वंडरफुल सेशन एंड फॉर टेकिंग आउट टाइम. एंड मिस्टर जॉनसन तो अगेन मेरे को भी अच्छा लगा बिकॉज मेरे साथ मेरा टीम भी, आप यू हैव मेंशन्ड अबाउट माय टीम इज एक्चुअली कंप्लीटली फीमेल्स. So I have known in my male member in my team. So we are planning to hire one in the operations. So I was okay. मैंने देखा okay Johnson है तो मेरे साथ somebody else is there. So anyway, I stay nearby to you, your to hospital. Thank you very much for your session. And मैंने सबसे बड़ा in between मैं मजाक में बोल रहा था, even though मैंने देखा सब लोगों को ये पसंद है क्योंकि हमारे अंदर एक प्रॉब्लम है. हम क्या कहते हैं भाई काम दूसरे से करना हमको बहुत पसंद है. और उससे पहले जो जॉनसन वाज टॉकिंग अबाउट लॉट ऑफ थिंग इन द स्टार्टिंग, नो बडी वाज इंटरेस्टेड. द मोमेंट बोला डॉक्टर एंटर करेगा वो आपको ऑटोमेटिकली जाएगा ऑर्डर. बोले ये तो मज़ा आ रहा है भाई और हमारे को एरर में पकड़ेगा नहीं. सबसे बाद मेडिकेशन पे तो नो बडी विल आस्क यू एनीथिंग. सो एनीवे एक्चुअली दैट्स अ फ्यूचर वी आर गेटिंग इनटू. वी ऑल्सो लाइक एट द सेम टाइम दैट्स नॉट अ ईजी थिंग ऑल्सो राइट. अभी आप सबको थैंक यू बताना है क्योंकि आपके बिना ये प्रोग्राम सक्सेस नहीं होता था. और मेरा जो बॉस ने एक ही चीज़ पूछा था, लोग आएगा क्या. सो वी बोथ वेयर गिवन कॉन्फिडेंस टू हिम. वी सेड 100% लोग आएगा. और हमने बोला ये 100 हमने वी वेड एम टू फॉर 200 पीपल. एट द सेम टाइम हमने बोला रजिस्ट्रेशन अपने हॉस्पिटल में ज़्यादा नहीं करना. दैट वॉज अगेन अनदर काइंड ऑफ क्लियर इंस्ट्रक्शन. But we were able to manage 200 people. So thank you very much for all the hospital. You have taken time and I think हम लोगों ने, हमारे टीम ने आप लोगों को सबको संभाला, खाना अच्छा खिलाया, है ना. ओके साथ में उससे ज़्यादा मेरे को भी पूछना है, आपने कुछ समझ किया क्या? आर यू लर्न समथिंग फ्रॉम सुबह से लेके? हाँ पक्का. फिर तो yeah. So thank you very much. And मैं अपने टीम को थैंक यू बिना कैसे मैं एंड करूं. The entire core team and the other complete nursing supervisors and everyone, thank you very much for your support and your energy. And काफ़ी सारे लोगों ने कल रात में भी काम किया था because सारा फिनिश करना था. फिनिश वो होता है ना, लाइक शादी से पहले एक बार तैयारी करना होता है. So thank you so much once again. And thank you. Thank you so much, sir. Presence of so many distinguished guests on this occasion is absolutely a blessing for all of us. We will believe that this conference will not only broaden your knowledge, but also leave you inspired, motivated and ready to contribute to a brighter future. Once again, thank you all being a part of transformative event. We look forward to seeing you again at a future events. Have a great day. Goodbye. But please join us for high tea, and after that, please collect your gift from our registration counter. Thank you so much.